Good afternoon, and good afternoon to everyone. The Committee of Health, Hospital, and Human Services is hereby called to order. Good afternoon to the listening and viewing audience. Today is the day of celebration as we recognize the African Liberation Day. It is also a sad day as we mourn the lives lost in the mass shooting in Uvalde, Texas. Gun violence is a public health crisis in this territory and across the United States. I ask that you join me for a moment of silence for the 19 students and 2 teachers who were killed yesterday at the Robb Elementary School. Thank you very much. Today, the Health, Hospital, and Human Services Committee is meeting to receive an update on the Jfl North and other items relating to the hospital's operation, and we'll also hear from the agency representative on their efforts to manage our edible use in the territory. The committee will also receive an update from the Department of Health and COVID-19, which I'm happy to hear that we are transitioning into the endemic phase. This committee last received an update on the Jfl North and the Juan Francisco Louis Hospital operations in January, which was soon after the CEO, Mr. Cook, took the helm. Today, in addition to the update of Jfl North, we'll also dive into the findings of the Inspector General's audit, staffing, and recruitment. After hearing the media campaign on edible use, I also thought it was important for us to have a broader discussion on the prevalence of edibles in our community. Today we'll hear on the specific steps being taken to educate our young people and the greater community about edibles, and that will be done in block number 2. Before I proceed, I'd like to congratulate all of the Verzon students on their promotions and graduations. I attended several of the ceremonies, and I certainly congratulate all on this milestone accomplishment. You are the future of the Verzons, and I look forward to the ways that you will serve and contribute to this territory. At this time, I'd like to advise everyone present to please turn your cell phones on silent or turn them off as not interrupt today's proceedings. All testifiers, that's virtually, please mute your device at this time unless you're speaking or called upon to speak. Madam Clerk, please call the roll.
Senator Marvin A. Blyden. Senator Blyden, present. Senator Samuel Carrion. Senator Carrion, absent. Senator Kenneth L. Gittins. Senator Gittins, present. Senator Alma Francis Heiliger.
Present.
Senator Francis Heiliger, present. Senator Janelle K. Soro.
Present.
Senator Soro, present. Senator Kurt A. Vialet. Senator Vialet, absent. Senator Novell E. Francis Jr. Senator Francis Jr., present.
Senator Vialet is present as well, Madam Clerk.
Mr. Chairman, you have 6 members present, 1 absent.
Very well, Madam Clerk, we do have a quorum and prepared to proceed. At this time, would you please read today's agenda into the record?
The Committee on Health, Hospitals, and Human Services has scheduled a hearing on Wednesday, May 25th, 2022, 12 p.m. in the Fritz E. Lowette's Legislative Conference Room on St. Croix to receive testimony on the Governor Wang F. Louis Hospital and Medical Center's audit, the status of Jfl North, staffing levels, and the recruitment process at the hospital. The committee will also receive testimony on underage drug use, specifically edibles in the public schools and the territory, as well as an update on COVID-19 in the territory. Block 1, the audit of the Governor Wang F. Louis Hospital and Medical Center, the status of JFL North, staffing levels, and the recruitment process. Invited testifiers, Mr. Doug Cook, Chief Executive Officer, Governor Wang F. Louis Hospital and Medical Center. Mr. Christopher E. Finch, Chairman, Virgin Islands Government Health and Hospital Corporation. Block 2, drug use, specifically edibles in the public schools and the territory. Invited testifiers, the Honorable Raquel Berry Benjamin, Commissioner, VI Department of Education. The Honorable Justa E. Encarnacion, Commissioner, VI Department of Health. The Honorable Kimberly Kazi Gomez, Commissioner, VI Department of Human Services. The Honorable Ray Martinez, Commissioner, VI Police Department. Block 3, update on COVID-19 in the territory. Invited testifier, the Honorable Justa E. Encarnacion, Commissioner, VI Department of Health.
Thank you very much, Madam Clerk. At this time, we'll go to Mr. Finch. Yeah, you ready?
Sure.
We'll go to you for your testimony.
Thank you. Good afternoon, Honorable Chairman Novelli Francis Jr., other members of the Committee on Health, Hospitals, and Human Services, other senators attending, Senate staff, Governor Juan Francisco Luis Hospital leadership, other testifiers, and the listening and viewing public. I am Christopher Finch. I am a member of the St. Croix District Governing Board for the Governor Juan F. Luis Hospital and chairman of the Virgin Islands Government Hospital and Health Facilities Corporation, commonly known as the Territorial Hospital Board. Thank you for this opportunity to testify. I was asked to testify today on the recent audit of JFL by the Office of the Inspector General. I will concentrate my remarks on that subject. JFL CEO, Mr. Doug Cook, is present and testifying on a wider range of JFL-related topics. The Executive Director of the Hospital Redevelopment Team, Mr. Daryl Smalls, is also present to answer questions on the status of JFL North and the new JFL building. On April 26, 2022, the Office of the Inspector General released their audit findings in a document titled Audit of Juan F. Louis Hospital Contract Administration. The audit was initiated based on a request from the St. Croix District Governing Board for the Governor Juan F. Louis Hospital. The objective of the audit was to determine if the hospital solicited, awarded, and monitored contracts per its policies, applicable laws, and regulations. The audit covered the period from 2017 through 2019. The audit work began around March 2019. Juan F. Louis financial staff cooperated with the Office of Inspector General during the auditing process, providing needed documentation. On February 1st, 2022, an exit conference was held with the OIG to discuss the draft of the audit findings. Attending from the hospital were JFL CEO Douglas Cook, myself as Territorial Board Chair, Dr. Olivine Treasure as the Juan F. Louis District Board Chairperson, as well as other board members. Following the exit conference, the Juan F. Louis administration, the Territorial Board Attorney, and I provided additional information to the Office of Inspector General. Subsequently, we received their final draft and added our response on April 11th, 2022. As mentioned earlier, the audit was then publicly published on April 26. Findings. There are 3 findings regarding internal controls, questionable management decisions, and frequent management turnover. I will address these in order. Finding 1, internal controls. For finding number 1, internal controls, the OIG determined that hospital officials, quote, did not always follow the internal controls put in place to safeguard the procurement of goods and services, end quote. The 2 concerns raised were, 1, that the hospital staff did not always utilize competitive bidding and follow its procurement and approval processes, and 2, that the process requiring the board to approve expenses and contracts exceeding $100,000 was not always followed. Hospital procurement policy requires competitive bidding for items costing over $25,000, with exceptions possible for medicine, for hospital laboratory or surgical equipment, for emergency goods or services, and repair parts and services to existing equipment. Those are the exceptions. The hospitals are also required to get a board approval for procurements costing over $100,000, whether that is a single payment or a combination of payments over time for the same item or service. The audit detailed 3 vendors receiving over $25,000 in 2017 for 4 non-competitively bid services in 2017. The audit identified 5 instances between 2017 and 2019 where vendors were paid over $100,000 and there was no evidence of board approval. These expenses were spread between rent, supply, and services. In 2 of those situations, expense was just over the $100,000 threshold, and in 3 instances, it was significantly over, with the largest being a payment of $390,368 for dietary supplies. The audit also identified instances whereby service cost amounts were increased and approved contracts were modified for increased cost and/or change orders approved without evidence of board approval. The Office of the Inspector General made 4 recommendations regarding this first finding, and they are: 1, management follows its procurement policies and procedures, regulations, and board requirements. 2, management follows its competitive bidding requirements, ensures that any deviations and justifications are documented. 3, management personnel provides time-sensitive reports specific to payments made by the CEO or designee over the $100,000 threshold. And the 4th recommendation, management properly safeguard and maintain contract documents. The Territorial Hospital Board agreed with the findings and recommendations. We have already implemented several safeguards to ensure that procurements are properly conducted. For example, 3 years ago, an updated detailed procurement and contract policy with a clear division of roles, including the procurement specialist, record-keeping requirements, executive and board oversight, was implemented to ensure checks and balances. Procurements are discussed with board members during district board meetings and territorial board meetings, at both finance committee meetings and full board meetings. Procurements exceeding $100,000 are approved at the territorial board level, having been through vetting via the committee and district board levels. As chairman, a few times a month, I host a procurement meeting with the hospital CEOs and the executive director of the hospital redevelopment team, their procurement officers and attorneys, to discuss upcoming procurements. Safeguards are based on diversification of tasks and authorities. Both hospitals, as well as the hospital redevelopment team, at the requirement of the board, have hired procurement officers to guide the procurement process through developing scopes of work or equipment needs, issuing RFPs, appointing bid evaluation committees, and making recommendations for leadership and board approval. Complete procurement files are made available for board members so that we can know the scope, learn the efforts at advertising the RFP, be aware of the various bids and prices, and ask questions about the need, process, and recommendation. Once board approval is given, and to be certain, the board spends considerable time on procurement matters, contracts are developed. As chairman of the Territorial Board, I sign all contracts exceeding $100,000. Subsequent change orders, even for a nominal amount that will increase a board-approved contract or bring a lower-cost contract above the $100,000 threshold, must come back to the board for approval. JFL is in the process of procurement and implementing Office 365 and SharePoint as its file management system to maintain procurement files and ensure access to all who need the information for operational and oversight purposes. Based on discussion and our response, the Office of Inspector General determined this first finding to be resolved and partially implemented with a need for continuous monitoring. I assure the Senate that the board will continue its emphasis on continuous monitoring of procurements. Finding 2, questionable management decision. Finding number 2 covered questionable management decisions. Again, the audit covered from 2017 to 2019. The Office of Inspector General emphasized 3 actions where they questioned the management decisions. These were the temporary acquisition and retrofitting of 2 operating room trailers that were not put in use, the continuation of an emergency repair service for 3 years, and the decision to separate the purchase of furniture, fixtures, and equipment, which I'll refer to as FF&E from now on, from the construction of the temporary hospital structure now named Jfl North. The Office of Inspector General made 2 recommendations for this finding. 1, the hospital's management adequately plans its procurement needs to ensure that its projects comply with all regulatory requirements. 2, the hospital management engages, as needed, the services of professionals in the respective capital projects field to ensure that its projects are aligned with the hospital's requirements and regulations. While we provided rebuttals in some of the specifics, there were commonalities among the examples used that we agreed with. And these were 1, the need to ensure that procurement meets regulatory standards, requires considerable planning and attention to detail. 2, the length of time to complete procurements led to costly delays. And 3, information was not always relayed from one leadership team to the next, which contributed to overspending. The auditing examples regarded sewage removal, emergency surgery capacity, and cost-saving efforts for Jfl North. These were laudable attempts to provide responsible care and keep the hospital operating, and were done in the post-hurricane time when Jfl faced numerous crises. Yet they were plagued with either or both delays and cost overruns. In the case of Jfl North, the initial thinking that Jfl would be repaired and not replaced influenced decision-making that turned out to be disadvantageous when the agreement was made to build a new hospital. Additionally, the decisions to separate the acquisition of furniture, fixtures, and equipment and radiology services from the construction contract for Jfl North, and then the subsequent decision to have the contractor provide the FF&E and install radiology in a temporary hospital. These decisions, while made for the purposes of achieving cost savings, proved to be costly and additional time to open the facility. For the situation of the temporary operating room trailers, my understanding is that Jfl thought it was receiving trailers that were already outfitted as operating rooms and were already CMS certifiable. CMS being the Center for Medicare and Medicaid Services. Following the hurricanes, Jfl very much wanted to regain the capacity to provide surgery to the community. These trailers were borrowed, one from New Jersey and one from North Carolina. The trailers that came late in 2018 were not outfitted as operating rooms. Jfl spent $1.4 million retrofitting the trailers. This was extensive work, and it took a long time. The retrofit was completed, and CMS had been asked to inspect the trailers and provide certification when the loaning states asked for their return in June of 2019. Since Jfl at that point was well on its way to reestablish 2 and then a possible 3rd operating room within the hospital, the trailers were returned as requested. From a board perspective, several lessons were learned that should ensure this does not happen in the future. This was perhaps a gift horse that should have been looked in the mouth. The hospital leadership has indicated it expected to get equipment that was certifiable and could be put into quick use. That was, I believe, a reasonable assumption, but regrettably was not the reality. Should such a need and opportunity arise in the future, I expect we will ensure an item is regulatory compliant before we can procure it. We agree with the Office of Inspector General recommendations for proper planning for the use of professionals and managed capital projects. To accomplish that, the board created the hospital redevelopment team to work under board supervision in partnership with hospital leadership to manage all the rebuilding projects, including Jfl North and the new Jfl Hospital. Based on discussion and our response, the Office of Inspector General indicated that determined the second finding as resolved but not implemented. As a board, we believe the creation and use of the hospital redevelopment team goes a long way towards ensuring that future problems regarding proper planning and preparation is done for the major construction projects of the next several years. Continued frank and open discussion between the leadership and the board in its oversight role will help ensure similar future problems do not occur. Finding number 3, frequent management turnover. For the third and final finding, the Office of Inspector General Audit emphasized the amount of leadership turnover JFL has experienced in a 5-year period, inclusive of positions very integral to the procurement process. The OIG added concerns about a lack of administrative middle management staff to ensure continuity when top-level personnel change, and a lack of a data collection system to ensure all relevant staff have access to procurement data. The OIG made 2 recommendations for this finding. 1, ensure that the hospital is adequately staffed at the appropriate levels to ensure the operations are minimally impacted when high-level managers depart from the hospital's employment. 2, establish a continuity plan to ensure a prompt and appropriate response to critical management functions needed to ensure continuity in the hospital's daily operations. The Territorial Board recently completed the CEO search process and is confident we have appointed permanent CEOs at both hospitals to lead us into ever-improving performance in the future. The updating of a procurement policy, the addition of a dedicated procurement officer, and the board request for an updated vendor files are example of our work to ensure that information is not lost. As mentioned earlier, JFL is in the process of acquiring and implementing a new file management software systems with multiple points of access. Based on the board's response, the Office of Inspector General considers these recommendations for the third finding as resolved but not implemented, pending verification of any changes to policies and procedures, implementation of a succession planning process addressing leadership changes, and a retention and access to the institution's data. In conclusion, the board appreciates the Office of Inspector General's work. The OIG initiated the audit at the request of the JFL District Governing Board. We have agreed with the findings. The board and leadership recognized many of these problems before the audit was released, and work has been ongoing to create systems and processes to ensure the hospitals operate with high accountability to the public, our patients, and staff. I thank this committee for its continued interest in and support of the hospitals. This concludes my testimony. I'm available to answer questions at the appropriate time.
Thank you very much, Chairman Finch. Next, we'll go to CEO Cook for his testimony and introduction of his team.
Good morning, Honorable Senator Nobel E. Francis Jr., Chairman, Committee of Health, Hospital, and Human Services, Honorable Committee members, other senators of the 34th Legislature of the U.S. Virgin Islands present, and the listening and viewing audience. I am Douglas Cook, Fellow of the American College of Healthcare Executives, and I am the Chief Executive Officer of Governor Juanif Hospital and Medical Center. I appreciate the opportunity to be here this morning to discuss findings of the Office of Virgin Islands Inspector General audit of the JFL Contract Administration, the current status of the temporary JFL North Hospital, current staffing levels, and recruitment process at JFL. To assist in this presentation today, I have with us Acting Chief Human Resource Officer, Ms. Terry Lynch. Chief Nursing Officer, Doris Plaskett, is unfortunately absent due to her daughter's grandchild. Chief Operating Officer, Hazel Filbert. Chief Legal Counsel, Patricia Welcome, and Chief Information Officer, Gregory Bryant. We also have remotely Rosalie Jfl, Interim Executive Vice President of Finance. As far as the JFL audit, we would like to acknowledge the committee's request for testimony on JFL by the Office of Inspector General. Mr. Christopher Finch, Chairperson of the VI Government Hospital and Health Facilities Corporation Territorial Board, has provided testimony in regards to the JFL audit performed by the OIG. We will be happy to answer any questions related to this matter. Related to JFL North, we would like to acknowledge the committee's request for testimony regarding the current status of JFL North. At this time, Mr. Daryl Smalls, Executive Director of Hospital Redevelopment Team, will provide an update on the current status of JFL North project and the new hospital build. After Mr. Smalls has given testimony, we will provide an update on our continued efforts to maintain the main JFL hospital's physical infrastructure and equipment. Mr. Smalls?
Thank you. Good afternoon, Honorable Chairman Nobel E. Francis, Vice President of the 34th Legislature and Chairman of the Committee on Health, Hospitals, and Human Services, Honorable Senators of the Committee, other Honorable Senators of the 34th Legislature, Senate staff, fellow hospital testifiers, and the listening and viewing audience. My name is Darrell A. Smalls, Executive Director of Facilities and Capital Development for the Territorial Hospital Redevelopment Team, which I serve under the leadership of Chairman Christopher E. Finch of the Virgin Islands Government Hospital and Health Facilities Corporation. Thank you for this opportunity to testify today as to the status of the temporary hardened structure, or JFL North, here on the island of St. Croix. As the Executive Director of the THRT, my primary role is to manage and oversee the planning, programmatic design, final design, bidding, project management, construction, procurement, and closeout for the redevelopment of the Juan F. Louis Hospital, the Roy L. Schneider Hospital, the Charlotte Kimmelman Cancer Institute, and the Myra Keating Smith Community Health Center. With respect to JFL North, I am pleased to report that we are actively under construction and on track to complete the mechanical building which will house the critical systems required for the temporary hospital to operate. These systems include various components of the life safety system, the domestic water system, the medical air and vacuum systems, oxygen systems, emergency generators, and the fire suppression system, which are scheduled to be completed by August 2022. Several of these systems are currently on island, in transit to St. Croix, or in various stages of production at the respective manufacturers on the mainland. In addition to the construction activities, we are also actively engaged with the staff of Juan F. Louis Hospital for the coordination of the actual transition process from JFL to JFL North. While this coordinated effort is no small task, the Territorial Board, the executive leadership of JFL, the various vendors and contractors, along with the THRT, are committed to ensuring not only the timely completion of the construction activities, but the safe transition of patients, staff, and equipment to the new facility. The construction of the mechanical building, which commenced in December 2021, is approximately 50% completed. Early in the excavation phase for the foundation construction, we encountered challenges with the existing soil conditions that required mitigation prior to the installation of the foundations. Since then, we have made significant progress with the construction of the first floor, and by the end of this week, we will commence with the construction of the second floor. Once the second floor slab has been poured, the installation of the mechanical systems that will be housed on the first floor will begin. It is important to note the construction of the mechanical building, which was not a part of the original JFL North construction, became an essential component once it was determined that the current systems within the Juan F. Louis Hospital could not support the systems of JFL North. Once completed, JFL North will be independent of Juan F. Louis Hospital, which will facilitate the complete demolition of Juan F. Louis. In addition to the foundation challenges, several solicitations we have issued for various activities have resulted in no respondents. These solicitations included project management services and construction services for the relocation of the existing propane tanks, resulting in us having to reissue these solicitations multiple times. While these are significant roadblocks we have encountered with this project, they are in no way excuses for not completing the project timely. My team and I continue to work tirelessly and creatively to obtain the required services utilizing the established procurement process. Once the mechanical building and the installation of the various systems has been completed, we will commence with the final inspection and commissioning process, after which the transitioning of patients will proceed shortly thereafter. Notwithstanding the current construction activities, the transition from JFL to JFL North is equally critical. The JFL team prepared a more than 600-page transition document that outlined all aspects of the transition, including the physical movement of patients, dietary services, pharmacy, the emergency room, and surgical services, to name a few. To date, we have met with all the key departments within JFL and conducted the first of several planned tabletop exercises. These tabletop exercises ensure each department is prepared and coordinated for the move day, which is scheduled to be completed within 48 hours after the first patient is moved. Equally important to the opening of JFL North is the coordination effort to ensure the continuity of operations and services currently provided by Juanif Louis Hospital. These services include, but are not limited to, the operations of the Virgin Islands Cardiac Center, outpatient radiology, laboratory, medical records, and the business office. We recently entered into a lease agreement for land to the east of JFL North, whereby we will construct temporary parking facilities, storage facilities, and as well as other operational requirements to support the interim location. We are also about to commence with the construction of an approximately 6,500 square foot, two-story structure adjacent to JFL North, which will house key critical administrative functions. While this construction is slated to be completed within 10 months once the notice to proceed has been issued, JFL will perform these services within interim spaces of the VICC. The remaining non-clinical functions and employees will be transitioned to a temporary facility while JFL is demolished and the new Juanif Louis is constructed. Since our last presentation, the Territorial Hospital Redevelopment team has grown to meet the increasing demands of the Territorial Hospital rebuilds. To date, the team is comprised of educated and talented staff, which includes an executive assistant, 3 engineers, an experienced former FEMA disaster recovery specialist, 2 experienced procurement personnel who are versed in both federal and local procurement processes, a project framework designer, a clinical consultant, and project monitoring specialists. Before I conclude, I want to thank the Office of Disaster Recovery, led by Ms. Adrienne Williams-Octolin. Ms. Williams-Octolin continues to advise, assist, advocate for, and push us on all recovery projects. Equally important, I want to thank the Territorial Board, the executive leadership of the Juanif Louis Hospital, and the staff of JFL for their support to the Territorial Hospital Redevelopment team. This concludes my update on the status of the progress for JFL North, and I will remain available to answer questions at the appropriate time. At this time, I would like to return the presentation to Chief Executive Officer, Mr. Douglas Cook.
Thank you, Mr. Smalls. JFL remains committed to providing the highest quality care for our patients. As all are aware, JFL continues to provide care in a hurricane-damaged facility with an aging infrastructure. Irrespective of the transition to JFL North, the maintenance of the facility and its critical systems continues to be of the highest priority to ensure safe patient care. Significant financial resources have been expended to address the ongoing repairs, maintenance, and stabilization of the environment of care, life safety, and utility systems of the hospital. We remain optimistic that the infrastructure challenges of the existing JFL building will be eliminated as the result of a transition to JFL North. The Facilities Management Department continues to actively complete projects and repairs necessary to maintain the existing JFL building. Priority focus areas include the emergency power, HVAC, medical gas, fire suppression, fire alarm, vertical transport, air quality, and air handler units. Work is also ongoing on other key utility equipment by the Facilities Management Department. These ongoing repairs and maintenance are critical to the stabilization of JFL's infrastructure. The upkeep of the environment of care continues to be addressed as part of the routine activities completed by the Facilities Management and Environmental Services teams. Recently, the Labor and Delivery Unit was relocated on April 18th as a result of environmental concerns. AdCon Environmental Services a vendor that specializes in air quality testing and remediation, was selected to complete indoor air quality testing for the areas of concern. We are happy to report most of the air quality tests come back with good air quality. The rooms that were found to have air quality issues have been professionally remediated by AdCon environmental team of professionals. Upon remediation air quality test results, we will make a decision on when and how to move our patients and staff back to the L&D unit. We want to personally thank all the staff and the physicians for their continued cooperation through this temporary transition. The maintenance of JFL's medical equipment is a patient safety requirement and continues to remain a top priority for the hospital. The Biomedical Services Department continues to complete the ongoing maintenance of the critical medical equipment to conclude completion of repairs and oversight of preventive maintenance completed by the contracted vendors. Our goal is to ensure that there is an active preventative maintenance contracts for JFL's critical medical equipment. Most recently, JFL experienced intermittent downtime of the CT scan machine. This has since been addressed, and an active preventative maintenance contract is currently in place with the vendor. The system has also been affected by utility power electrical surges, which increases the risk of damage to the sensitive electronic components of the equipment. We are actively working with the vendor to evaluate if a UPS or universal power system will help reduce the impact on these sensitive electrical components. Additionally, JFL recognizes the need to augment revenue in an effort to stabilize the systems that are key to delivery of quality patient care for the people of St. Croix. JFL also recognizes the need to restore some of the revenue-generating outpatient services for which it once was a sole provider of, or at least reclaim its fair share of that market. These efforts are evident through the ongoing effort to upgrade the Meditech system, the Craneware software system, which, as all other industry platforms, require constant upgrades. In order to ensure a successful transition to JFL North, operational readiness activities for clinical, ancillary, and support services have begun. Operational readiness activities focus on the review and coordination of all aspects of hospital operations to provide safe and efficient patient care services. Our community anticipates the long-awaited transition to JFL North, and we are diligently working in collaboration with Mr. Smalls and the hospital redevelopment team to achieve this goal, as we focus on our operational readiness activities to include plans for patient movement to the new temporary facility, regulatory compliance with the Center of Medicare and Medicaid Services, or CMS, conditions of participation is a top priority. It is important to note that there is no distinction between the regulatory standards for a temporary or a brick-and-mortar facility. JFL will continue to work towards this goal to ensure compliance with regulatory requirements and provide safe quality of care for our patients. In regards to staffing levels at our current facility, the staffing plan for nursing services was developed based on the staffing and skill mix needed for the total number of inpatient beds, outpatient services, specialty services, and patient acuity. In our current JFL building, the staffing plan for nursing services is based on a total of 62 inpatient beds, in addition to the emergency room, operating room, hemodialysis, outpatient nursing services. As we continue to progress towards our plans to transition to JFL North, a similar nursing staffing plan has been developed that is based on the preliminary designation of inpatient beds, outpatient services, and specialty services that are relatively parallel to the current JFL nursing services. JFL staffing plan is based on both industry and regulatory indicators for each service line. The current nursing staffing plan reflects a need for 140 bedside staff RNs. Presently, there are a total of 73 bedside staff RN vacancies, an approximate 52% vacancy rate. JFL is currently supported by Pafford Staffing, provided through the Department of Health to assist with the critical clinical vacancies. We are also working with other staffing agencies to provide necessary interim staffing support. We would like to publicly thank the Commissioner of Health and her entire team for their ongoing support through Pafford Nursing throughout this pandemic. Recruitment and retention of registered nurses and all healthcare workers is a major priority and challenge in addressing nursing staffing levels. Our recruitment plan includes ongoing recruitment for permanent critical hires, implementing workforce development activity initiatives that grow local talent, utilizing staffing agencies to fill critical vacancies. Like many other hospitals, JFL is faced with the severe registered nurse shortage. Similar to healthcare organizations across the nation, JFL continues to be affected by increased employee turnover, known as the Great Resignation, critical staffing challenges, compassion fatigue, and decreased employee morale. To address the current nursing shortages, reestablishment of the graduate nurse program is one of the recruitment initiatives that have been successfully implemented. JFL has very close relationship with the UVI School of Nursing and has engaged all 14 of its recent nursing graduates to apply to the graduate nurse program. The graduate nurse program is structured to support new graduates as they transition from student nurse to a professional nurse by providing employment, preceptorship, and support with the nursing licensure examination. This program also extended to all recent nursing graduates, including those that have graduated from a nursing program outside of the territory. Additionally, JFL offers reimbursement for RNs who choose to further their education in pursuit of any national certificate program. The JFL leadership team utilizes a multi-pronged approach to improve employee morale. Strategic goals include improving the flow of communication, encourage employee feedback, creating opportunities for professional growth, as well as performance improvement and updating compensation packages. JFL supports an organizational culture that values each team member, providing an environment in which employees feel supported in our goal in order to receive honest employee feedback. Employee feedback is a critical tool in developing effective organizational performance and system improvement initiatives. In the last 5 months, we have implemented weekly JFL executive team meetings, weekly department staff huddles, quarterly JFL town hall meetings held on every shift, and the new Bright Idea program allowing for additional suggestion boxes for employees are encouraged to participate, as these programs help foster transparent communication, improved employee engagement, and satisfaction. This past week, I met with approximately 70 employees. We spent almost a total of 8 hours discussing very important issues to them, such as what's working well in the organization, who needs to be recognized, what needs to be improved, and what additional resources are needed to do your job. It is these types of conversations and development of partnerships that will help lead our organization forward. Thank you to those who actively participated in these sessions. I am looking forward to our continued involvement and feedback. In-house staff development is also a vital to staff satisfaction and retention. It is our plan to develop additional in-house educational programs to support staff development and cross-training to work in special areas of interest, such as the operating room, critical care, and labor and delivery. Additionally, JFL is working with Governor Bryan's office, as well as the Office of Management and Budget, to implement initiatives focused on monetary staffing bonuses as incentives for employees in order to continue to retain our dedicated workforce. JFL continues to work with our financial partners and stakeholders to seek funding to update collective bargaining agreements, grant incentive pay, and offer market rate salaries. In conclusion, I would like to first show how thankful I am for my executive leadership team. As a team with oversight of Mr. Finch and the board, We are committed to seeing the Jfl audit recommendations resolved and fully implemented. The previous administration successfully resolved many recommendations by the OIG. It is now our responsibility to now see those recommendations fully implemented. Thank you to the OIG for the work put into this report. I would like to share that although the JFL North Hospital facility has had its share of challenges, we are committed to a successful transition into JFL North. We acknowledge the concerns and frustrations with the delays of this temporary hospital. While we have experienced some setbacks up to this point, it is our goal to open this fall. Our goal is and always has been to provide quality health care to this community. JFL North will play a large and expanding role in health care on St. Croix and throughout this territory. We would like to thank our dedicated staff for their understanding and patience as we continue to maintain the current JFL building while working towards the transition to JFL North. We also would like to thank the community for their patience. Additionally, through the exploration of new recruitment processes, revitalization of past successful programs, and partnerships with the Department of Health, the goal is once again become a workplace destination and begin to fill critical staff vacancies. As I discussed with all of the wonderful caregivers and support staff who participated in last week's listening sessions, we are committed to developing a culture of us, where every member of the JFL team works together for the success of the organization. We each play a major role in making that a reality. As always, the JFL executive team thanks Honorable Senator Novell E. Francis Jr., Chairman of the Committee on Health, Hospitals, and Human Services, and the members of the Committee on Health, Hospitals, and Human Services for granting us the opportunity to provide testimony today. It is with your support that we continue working toward a shared goal of improving the quality of healthcare within this territory. Thank you again for the opportunity, and I look forward to answering any questions you may have.
Thank you very much, Mr. CEO, Douglas Cook, as well as Chairman Finch and Executive Director Smalls for your testimony this afternoon. Before we open up the floor for questions, I'd like to recognize the presence of non-committee member, Senator Javon James, Sr. Madam Clerk, please record him as being present. And just quickly, we'll be going to a 7-minute round. And before we do that, I wanted to ask you, Chairman Finch, in regards to that trailer that we got here and spent $1.4 million retrofitting that trailer, that seems like a serious lapse of judgment. I mean, how could we not see that that trailer would have to be returned at some point, and we went ahead and expended $1.4 million into that trailer?
Senator, that was before my time. The understanding that I have, because I think the first question was JFL thought it was getting operating rooms that it could put into use, and that turned out not to be the case. So the next question is, when they realized that wasn't the case, why not just return them right away without spending that? And I think it was the idea that it wasn't going to cost that much at first, but it was just one piece fell after another to lead to that. So as I said in my testimony, I think certainly the lesson learned from there is should that ever happen again, you'd have to make a serious decision about whether or not you'd put even a penny into it, or just return it. Because I think my guess would be is at that moment, if 1.4 million was put into the operating rooms within JFL itself, correct, you would have had your own operating rooms, correct, which is ultimately what JFL did. I'm not sure that the expectation was that the trailers would have to be returned as quickly as they were, but at that point, I think since JFL was able, it's better to be able to do the operations within a hospital facility. It just didn't ask to keep them longer. The two states wanted them back for a hurricane season. They let them go. Like I said, at that point, the work had been done, but New Jersey and North Carolina benefited for us fixing their trailers. They
certainly did. I also want to say it's commendable for the board to have asked for the audit to be done. And again, to kind of wipe the slate clean as you move forward to address some of those issues. And it's also commendable that you have accepted, some of the findings and do address some of the recommendation moving forward. I wanted to ask you, though, that you mentioned as well that the board leadership recognized that there were problems going back to 2017, and you agreed with some of the audit findings in regards to that. I mean, if that's the case, why was there a delay in action in being able to move forward with some of the recommendations that have been made prior to, if you recognize that, in fact, that the audit did recognize the weak points of the facilities and the process?
I'm not sure that that there really was a delay. As I mentioned, the updated procurement policy, and there was a procurement policy in place, but the updated procurement policy was put in place about 3 years ago. So that, initially in 2017, as we all know, and then through 2018, all the focus was on just keeping the hospital open and in the post-storm environment. But the increased, written procurement policy, the requirement of separating out, very formally the decision-making so that not one person is doing a scope of work, issuing an RFP, getting the bids and deciding who gets the bid, but that's multiple people, et cetera. All that policy is about 3 years old now.
Okay. All right. So I think the finality is that you do recommend, you do intend to, and your reassurance to this body that, in fact, moving forward, some of those items will be addressed, and actually the board will have oversight in some of those areas that needs their oversight, because, in fact, the policy was in place. However, it seemed that the board neglected to do some of those things back then in 2017 and beyond. But I'm hearing that there's a commitment from you and the current board to make sure that those oversight responsibilities adhere to.
Right, there is, and Senator, even the informal procurement meetings that I mentioned that I hold, my predecessor as chairperson is the person who started that. So this has been going back for a while, that there's been board attention on improving the procurement process.
Okay, very well. I'd like to open up the floor to my colleagues at this time. We'll have a 7-minute round. We also like to recognize the presence of Senator Franklin Johnson, who has been here from the beginning of the hearing, and he fit in so well. I thought that he was actually a member. Thank you for being here, as well as committee member Senator Samuel Carrion. Thank you for joining us, Senator. We did recognize and read your tardy letter, and again, all condolences as you attended that funeral service for family members. Senator Blyden, you recognize for your 7 minutes at this time.
Thank you so much, Mr. Chair. Good morning to my colleagues, viewing, listening audience, staff, central staff. Good morning, testifiers, and thank you so much for your testimonies. Of course, my first line of questioning will be in regards to the audit, because I know time and time again, the audit report refers to examples where the executive leadership acted contrary to the board's policies or instructions, or in which the board expressed concerns among various practices and procedures to include expenditures, but nothing changed. They continued anyway with their practices. And to make a long story short, it seems that often the board at that time simply failed to properly monitor or control the actions of the executives that they hired. And this seemed to be a long-standing issue at JFL prior to the audit. So I know Chairman Finch, you mentioned in your testimony in terms of what the board is doing in respect to the audit and responding to the findings, but what else is being done to address this long systemic issue at JFL moving forward?
There is a considerable focus on procurement. I mean, there's rarely a meeting that does not deal with procurement. The board has requested that JFL maintain this data collection system that all board members would have access to, so that we can review vendor files for ourselves. The board has also been asking for updated vendor files so that we're aware. When we're talking, just to put things in perspective, the procurement at both of the hospitals is tens of millions of dollars a year. It's not a small amount. And I really can just emphasize that everyone on the board now is really fully engaged in the process of knowing to ask for complete vendor files, et cetera, that before we make decisions. Much of the difficult vetting, if you will, is done in the Finance Committee at the Territorial Board, which is chaired by the Director of the Office of Management and Budget. But I'm a member of that. There's several board members, including all the cabinet members, are members of that committee, and Dr. Jerry Smith. I think both hospital leadership would say that those meetings are not a whole lot of fun.
Very well. Thank you for your response. And on page 9 and 10 of the audit report, it outlines an instance in which a contract for an amount of $660,000 was amended, and without proper board approval, to an amount of approximately $1.7 million. Further, the report found that the board's chair signature on one of those amended documents had been forged. Did a formal investigation on this fraud take place? And was the matter referred to the Attorney General's office for further action? And if so, what was the outcome? If not, why not?
Senator, I'm not aware of any referrals that happened at that time. When the audit was released, it's also, and as you see in the audit, is sent to a number of law enforcement agencies, including the Office of Attorney General. I believe, and this is sort of on information and belief, that incident was one of the key factors that led the board into requesting the Office of Inspector General to come in and do the audit. And it also was a factor in major personnel changes that were done at that time.
Okay, very well. With that being said, Mr. Chair, through the chair, can I request a copy of the minutes of all board meetings between 2017 to present, please, through the chair. Also, one of the most serious issues facing the Juanif Louis Hospital, according to the audit report, was the lack of qualified middle management staff to provide continuity in the face of frequent changes at the top when it comes to leadership. And obviously, the lack of middle management personnel doesn't just impact institutional memory, it impacts every aspect of the operation. Where are you in terms of building more capacity and increasing your middle management staff? And this to Mr. CEO Cook.
Thank you. The idea of increasing the amount of middle management is a balancing act as far as we want to make sure from a clinical standpoint that we are keeping as many clinical people as close to the patient and as close to the bedside as possible. Acknowledging, though, that we need to constantly be working to teach and grow and mentor internally those people that have leadership skills and put them in situations where they can be successful. So the concept of creating a succession planning process so that we are teaching others what we already know so that they can move into positions quickly is very much needed. And it's not only about the person. I would say that the OIG report notified and spelled out that we need to work on making sure that we have systems in place that allow for the transition of documents and information within our organization.
Well, where does training come in? What part does training play in terms of addressing that concern? Don't you believe that will play a big part of that?
Yeah, I think training will be a big part of it. A lot of it is done internal, and I would say on the job, depending on the person's skill set and what they bring to the table. As we talked a lot about procurement here, and we have a phenomenal director of procurement. Again, that is a single entity right now. What we are working on is how do we expand that and so that her and her team are becoming aware and educated and trained on what all the procurement policies and procedures are that I, as the CEO, am held to, the executive team is held to, and that we work in partnership with the board.
Okay, thank you for that. Edie Smalls, good afternoon. How are you doing today?
Good afternoon, Senator.
First, I want to thank you for your leadership and what you bring to the table. I must commend you on that. You're usually on point all the time. Let me ask you, by the truth, in respect to all the time, you, in respect to your testimony, you spoke to a few challenges and you talked about basically still pushing forward to assure that those tasks gets completed.
30
what
seconds.
other challenges are you facing at this time, if any?
Well, good afternoon, Senator. Thank you for the question. I think really the major challenge that my team and I face with we weren't there at the beginning of the project, so we've inherited and really trying to come up to speed and to truly understand the full gamut of what was proposed and what needs to be done, and making sure that at the end of the day we have a qualified facility that we could stand in until we get the new facility.
Do you have any challenges with procuring materials, etc., equipments, or?
I would tell you there's a worldwide challenge in terms of procurement right now. So one of the things that we were able to do with this particular project right now is at the onset of the project, we asked the vendor to identify all of those long lead items. And with that information, we were able to start putting down deposits to be able to get those items so it would not delay the project. So that's one of the avenues that we looked at.
Mr. Chair, can I conclude?
You may conclude, Senator.
And finally, Edie Smalls, you said you are being creative also in terms of moving forward. What are some of the creative ideas you have came up with in order to assure that you move forward on time?
Well, I think one of the things, inheriting where we were, some of the procurements may have involved multiple components, so we couldn't get a contractor who was capable of doing multiple items simultaneously. So what we're looking at doing is breaking them down into perhaps smaller projects so you could get vendors involved.
Thank you for your response. Thank you, Mr. Chair, for the time.
Thank you very much, Senator Blyden, for your line of questions. Going back to Executive Director Smalls very quickly before we go to the next senator, which is Senator Franklin Johnson. What are we doing currently with the equipment in JFL North? Or I'm not sure if you will be able to answer that question or anyone else. Are we exercising those equipment? Are they just dormant? What's happening? That's one of the concerns that have been raised by the public. What's occurring with the equipment to make sure that they're properly exercised during this down period?
Well, one of the fortunate things that has happened during this time period, we've actually had to utilize some of that equipment within JFL. But more importantly, you heard me mention about the commissioning process. That commissioning is just that, getting that equipment up and running and making sure that the day that we're moved in, everything is up to standards, inspected, and ready to perform.
So you're saying, in actuality, all the equipment is actually being used, or at least they're performing
Not all
some?
of the equipment is being used. Quite a bit of it is being used. We do have a biomedical department, and right now, part of that transition process is identifying those key items, making sure that the preventive maintenance has been performed, and making sure that we have everything in place so that there's nothing to hamper our startup.
Very well. Senator Johnson, you're recognized for your 7 minutes at this time.
Good afternoon to my colleagues. Thank you very much, Mr. Chair. Good afternoon to the testifiers. Good afternoon to the viewing and listening audience. I'll start with Mr. Chris Finch in your audit report and part of your testimony on page 3. The audit identified 5 instances between 2017 and 2019 where vendors were paid over the $100,000. And then you go on to say in 2 of those situations, the expense was just over $100,000 threshold. But in 3 of them, that was past the 100,000, and one of the instances you put up was $390,000. Was that ever justified? And what was the amount of the other two that surpassed that $100,000?
Senator, I apologize. I thought I had brought a copy of the audit with me today, and I didn't. It is in the audit, and I can get back to you, but it was between 100,000 and the 390. I don't think there was a question that these were not justifiable expenses. The problem was that they did not receive the board approval, which is required because they were over 100,000.
All right, but in your investigation, it says here for dietary supplies, was these emergency cases why they went ahead and not comply with the guidelines for the spending?
And Senator, we didn't go back and second guess for items like this. The Office of Inspector General took it at face value because I know that they had worked with the financial office at Jfl for all these years. And so, as a board, we did not go back and take a look at these. Our focus was, how do we move forward and ensure this doesn't happen again?
All right. Thank you very much. And
I'm sorry, someone just gave me a copy of the
Great.
audit, but it would take me a moment to find that.
Okay, whilst you're looking for that out, for
No,
time's sake.
I found it, Senator.
Okay, go ahead.
I did find it. Do you want me to put it on the record?
Please, please.
Okay. I'll start from the lowest to the highest. One of the 5 payments that were over 100,000. One was a consultant payment for $100,682. One was warehouse rental for $106,399. One was services for Juanif Louis phone and communication system for $151,819. One was sewer services for $231,150. And then the final one was the one I had mentioned, dietary supplies for $390,368.
Thank you very much. Mr. Cook, I want to ask a question. Is the hospital still following the COVID protocol guidelines as far as when patient comes to the hospital?
Sorry, can you hear me?
Yeah.
We have a phased approach to our COVID visitation policy. Right now, we are in phase 2, which means we are restricting visitation, and it is limited to situations of end of life or support people that are needed as far as, if you have a pediatric patient, we allow a parent.
Well, where I'm going with my question, because it hit home for me. And one of my relatives brought their family to the hospital. And that individual was not allowed to enter the hospital based on your COVID policies and guidelines. The individual was not so much coherent. They couldn't explain what they were even going through. And that individual was sent home. A family member took them back to the hospital. And at that time, he was very demandful and demanded that he be able to explain what's going on with his fiancée. And if they had given him a chance to speak at the least, she might not have reached as far as she did. Thank God she's alive. She had an aneurysm. She had a lump on her head. She could not speak. She could not say nothing to anyone. And I'm saying all of this to say that the policy really hampers and could cause life if someone don't pay attention to who brought this individual to the hospital. Boss is just shutting them out. This individual end up with a stroke. They're in a bad situation, and I think it could have been eliminated if they had only listened to who brought the patient to the hospital. So how do we intend to address this going down the line so something of this nature doesn't happen to the point that it costs a life?
First off, let me sincerely apologize that happened to you, your family member. That is not the intent of the policy. The intent of the policy is to protect the patients within the hospital and the community from further spread of the COVID pandemic. It reminds me of earlier on in this COVID pandemic when I lost in-laws, husband and wife, transferred to two separate hospitals and unable for any family member to see their parents before they passed away.
2 minutes.
It's had a negative impact on many of us. That said, I want to acknowledge if we did not follow or listen to the family member well enough, because what you're describing there should be an opportunity for the physician to write a order that allows for the patient to have a visitor or a support person with them.
But that did not happen. And he was left outside the hospital, and they try and communicate with her. And when she came back through a little bit, she was pretty much sent home. And time was so much of an essence when it comes to an aneurysm, with no one knowing that this person, what they was going in and out. So I just hope that no other family have to go through what my family went through, because we could have lost that individual very easily.
Yeah, we acknowledge that the patients, and there's been plenty of studies out there that show that patients heal faster when they have loved ones around them. And obviously that would be our goal, to return to that as soon as possible.
My line of question will go to Mr. Small. I saw in your testimony you said that you're at 50% for the mechanical component there. With being at 50%, would you be able to meet the deadline or the time date that you have in plan for utilizing JFL North?
Yes, based on our construction schedule, the 50% is primarily the building itself, the shell. But much of the equipment that goes into the shell is either here on island or in transit. So we're not waiting for the shell to be completed. As the floor slab goes in, we're beginning the installation.
About what percentage of your equipment that you need for inside that's off island is not here? Or what percent? Because you say you have some on island already and
30
some that
seconds.
are transit into island. What percent would you say?
I would say we're probably almost 50-50 there as well. For instance, one of the items that we're waiting on is the fire pump, which is the longest lead item. We're waiting for the water storage tank that is being manufactured on the mainland, and within a 3-week period, then it will be shipped. So that's why we're confident with our timelines.
All right. Back again to JFL North, and I think we're spending some money with EKG, different type of imaging that folks have to go to a private sector. Are those equipment in JFL North up and running and can be used?
Time.
I think the one specific piece of equipment you might be referring to is the CAT scan, the CT scan. Because we're not open for medical care, we would not be able to do that in that structure right now.
All right. Thank you very much, Mr. Chair.
Thank you, Senator Johnson. I think the MRI is also an area of concern in terms of equipment. Is that available in the JFL North?
Currently, there is no MRI in JFL North.
Yeah. Okay. Very well. And we still trying to wait on the costs of what an MRI, so that we could look and see how, as we go through the budget cycle, be able to fund that. I know that there have been some discussion before asking for what that cost should look like. I'd like to get that before the budget cycle, which is starting next month, so that we could look and being able to fund that. Before we go to the next senator, which is Senator Gittins, I wanted to recognize the presence of committee member, Senator Alma Francis Heiliger. Good afternoon, Senator. Thank you for joining us. Senator Gittins, you're recognized for your 7 minutes.
Thank you, Mr. Chair, and good afternoon to all.
Good afternoon.
I want to go to the audit, but before I go to the audit, CEO and Mr. Chair, are you aware of Act 8327, which speaks to or relating to the leave of absence to authorize administrative leave for first responders during a medical pandemic or a territorial state of emergency?
I am not aware of that.
Are you aware of the COVID Leave Act, Act 8327? I'll share it with you, and your HR person is here. Ms. Lynch, are you aware of this Act, 8327?
Good afternoon. Yes, I am.
All right. Are we adhering to the Act as if any employee within the hospital contracts the COVID or has to quarantine because they came in proximity with someone and there's a concern, are we granting the leave as per Act 8327?
Currently, we are adhering to the act and we are following the guidelines as prescribed by the CDC.
Thank you. And before I get into the audit again, I also want to ask whether or not the administration have reached out to the hospital administration with regards to premium payments to hospital employees.
The premium payment program is currently in progress in collaboration with the Office of Management and Budget. We are currently preparing for that.
In your preparation, are you preparing for individuals who are making in excess of $70,000 as well?
We're preparing in compliance with the guidelines set forth from OMB.
So the guidelines set forth by OMB doesn't seem to coincide with the guidelines set by the federal government. So I'm asking whether or not you're prepared to do those justification documents for your employees who makes over $70,000 a year. And I am going to be stern on this because you are in the trenches when it comes to this COVID leave. And I'm hoping that the administration takes this into consideration and look out for these individuals. So are you prepared to submit those justification documents for nurses, doctors, or whatever other positions that may be making over $70,000 a year that can't stay home and do their functions?
Senator, thank you for the question. We are preparing those documents, and we are providing the information for all employees that work during that period of time, regardless of what their compensation was, and regardless of if they are still currently employed or not. We are providing a detailed list of all the employees that work during the period of time requested.
Thank you, and I'll be monitoring this closely. Now, let's first establish something here. According to the Inspector General's report, which I'll refer to as the IG report at times, hospital officials mean, when they say hospital officials, they mean the management and administration and not the board, correct?
That's my understanding, Senator, I think in general cases.
Thank you, and if you could, when you're responding, if you could just state your name and your position, because the court stenographer or the stenographer is not present in the room and they need to know who's responding. So that was Chairman Finch. Thank you. Now, with regards to the internal controls, officials didn't follow the protocol or safeguards put in place for expenses and contracts amounting over some $100,000 to be approved by the board. That said, who, if anyone, did the board held accountable for not following the proper protocols?
Senator Chris Finch, Chair of the Territorial Board. There was a decision by the board at that time to make changes in upper management around a number of these issues. I do want to keep perspective without minimizing the importance of this and the fact that it was wrong for it to happen at all, but that in terms of a percentage of total procurement, in most cases the policy was followed. These were cases where certainly wasn't for whatever reasons. Our focus as a current board has been to go forward.
Excuse me, Chairman Finch. I want to be respectful with your responses and to allow you to respond, but I don't want the long political answer. I just want to be succinct. Was there anyone held accountable with regards to this. And in your statement, you agreed with the findings and recommendations of the IG report. So my question in this case, with regards to these contracts and expenses over $100,000 and the violations of these protocols and safeguards that's in place, was there anyone held accountable?
Senator, I would have to do more research to understand how many of these occurred under a CEO that was dismissed and how many subsequent to that.
So these sanctions wouldn't come to the board?
They would have at that time, and that's what led to this report being done. As I've stated, our effort has been taking a look at the emphasis that started some years ago to make sure that the processes were tight enough this doesn't happen.
Let me put it this way. Have there been any instances where the board held management accountable for their failures of adhering to the policies and procedures? Yes or no?
Senator, I don't know the answer to that before I joined on the board. Since I've joined on the board, this has not come up as an issue.
So we don't know if anyone was held accountable. We don't know. All right.
We do know that there was a change in CEO.
Yeah, but
that
the
was
change in
related
CEO,
around-
the change in CEO wasn't you're fired, we're hiring somebody else. It was that they were temporary and you were looking for someone else.
Yeah.
I think we're kind of evading the questions here. The board is the governing board. And when I make a vote here in this body, when you come before the Rules and Judiciary Committee, I always tell people that every top must sit on their own bottom. And I expect for that to happen throughout your tenure, that you're able to make the decisions prudent and practical. And in this case, I am asking just a straightforward question, and I can't get an answer as to whether or not someone was held accountable. I keep saying over and over and over that this was going to be about accountability.
2 minutes.
Accountability. And who I am going to hold accountable, especially at this point, reading such a glaring IG report, is the board. The CEO just came on board. All that we're looking forward dating back to 2017, 2015, etc. And there should be some type of continuity going on as well. And that too, we're seeing a lack thereof. On page 3 speaks to the 2 instances that just a little over $100,000 and 3 instances of where it was significantly over the $100,000. Did any one of these 5 that they speak of come before the board for your approval?
Senator, those were all before my time, but the discussion of the Attorney General was that these were not done, or they were not done certainly in the timely basis. I do want to be clear.
One second, because I don't want you to veer away. My time is pretty short, and the chair is going to be kind enough to allow you to speak whatever else you want to speak. I just want to stick to what I'm asking you. When did you come on the board?
In October of 2019.
2019. Do you have anyone on the board that's been serving prior to 2019?
30 seconds.
Yes.
Okay, so again, continuity, and we should have these documentations. Now, the board, is there still a resolution in place that allows for the CEO or his or her designee to be able to approve or authorize these payments on behalf of the hospital up to $100,000 prior to authorization from the board?
That's correct.
It's still in place?
Right. The
So-
CEO has a $100,000 spending limit.
So how are you monitoring this now to ensure that what the IG report is saying doesn't happen, such as those 5 instances?
Time.
Senator, through a number of items, as I mentioned, processes that were put in place to differentiate the roles and responsibilities so that one person doesn't hold all of those. The recommendations are made to the CEO, but the CEO is not choosing alone. The vendor files being kept, a data collection system being put in place to use a Dropbox, to have complete bidder files available. There's just a number of, perhaps each one small, but totally come to create this accountability system.
So time has been called, Mr. Chair. Can I just ask a quick wrap up?
You may wrap up, Senator.
What I want to know is there any documentation that has been put in place since your chairmanship now to ensure that there is no violations with regards to this resolution that was apparently made prior to your arrival? Now that you see that it is a problem, have you as the chairman or has the board collectively updated a document to ensure that there is no violation of this resolution? Yes or no?
Yes. That's the procurement policy that I mentioned.
Thank you. And with the updated date on it, through the chair, I'm asking you to submit that to this committee, please. Thank you, Mr. Chair.
Thank you very much, Senator Gittins, for your line of questions. Before we go to Senator VLA, who's the next senator, I wanted to ask you, CEO Cook, in regards to your testimony, you mentioned the fact that JFL is working with the Governor Bryan's office, as well as Office of Management and Budget to implement initiative focused on monetary staffing, bonuses, incentive for employees in order to continue to retain our dedicated workforce. Can you expand on that for me, please?
Yes, thank you for the question, Doug Cook, CEO of JFL Hospital. We have been working closely with the Office of OMB related to the, which I think you're referring to as the COVID incentive bonus program, which is federally funded, where the money is being obtained from. We have, working collaboratively with JFL and Schneider Regional Medical Center in St. Thomas, we have collectively worked together and submitted several different proposals to the Office of OMB of how to properly reward our great nurses and caregivers that have endured a lot through this COVID pandemic. So we have submitted those proposals to the Office of OMB, and we're currently working collaboratively with them to bring this to fruition as soon as possible.
Very well, so that you're saying that there's some light at the end of the tunnel. I know that the governor talked about it being paid out at early summer, June, July. Is there any light at the end of the tunnel that these employees could look forward to seeing this money in the near future?
Yeah, I sure hope so. Again, we are following what we've been asked to submit from OMB related to, again, the requirements that we've been told with regards to how the federal money needs to be spent. So we're providing that information to them. They've asked us a few questions back and forth, but I would hope that we're seeing the light at the end of the tunnel very shortly.
Do you agree that retention is critical, and that in fact we've been bleeding or losing nurses every single day? That it's critical that we are able to, again, retain the nurses by offering them this incentive?
Yeah, retention is even more important than recruitment. We can recruit all day, but if we're losing them just as fast in any organization, and this is a national issue, not just a territorial issue, but we need to retain all of the good employees at JFL in all of our hospitals. And, going through a pandemic, that becomes very difficult, but we need to create an environment where our employees feel valued and respected and want to work at. So, and compensation is a part of that.
Very well. So, Senator Gittins, you recognized for a quick point of inquiry?
Thank you,
Point of inquiry.
Thank you, Mr. Chair. I just wanted to inquire quickly to make sure that Chairman Finch understood my question with regards to your tenure on the board. When did you first come on the board, and when were you made chairman of the board?
I first came on the board, I believe it was October of 2019. It might have been November, but that period. And I became chairman in March of 2020.
Thank you so much.
Point of inquiry, Senator Alma Francis Heiliger.
Thank you, Mr. Chair. Point of inquiry to the chair. May I ask the order of questioning for the day, please?
Absolutely.
I'm trying to make sure.
So next is Senator Kurt VLA, Senator Janelle Sorrow, Senator James, Senator Carrion, and Senator Heiliger will close out this round.
Well, may I ask the reason why it was placed last?
Is we assigned you based on your appearance in the chamber today.
Well, that is what I wanted to correct for the record, because I was here for roll call, where the roll call was 6 and 1, and you inaccurately came on after and told the public, as well as my colleagues, that I had just arrived. So I wanted to make sure that you are aware as to the order, because I was here. Thank you.
Very well. The record will so reflect. However, when I observed and the roll call was made, you were not present or you were not accounted for at that time. At this time, Senator VLA, you recognize for your 7 minutes.
Thank you so much, Mr. Chair. Good afternoon to the people of the Virgin Islands. Good afternoon, colleagues, and good afternoon to the testifiers. Mr. Cook, you said that in reference to the premium pay, that you submitted a number of proposals. Have any of the proposals been accepted?
Thank you, Senator VLA, Doug Cook, CEO of Jfl Hospital. The question you just asked, you mentioned premium pay. I think you were referring to the incentive for the COVID bonus.
The COVID pay, yes. Have any of those proposals been accepted by
I wouldn't say they've been accepted. We've been going back and forth on making sure that the organization is putting forward the proposal that meets the requirements of the funds. And so we've submitted our most recent proposal, I would say.
What is a particular requirement?
What are the requirements?
In terms of salary, what is the max salary that a person can make in order to be eligible for the COVID pay? Is it 70,000?
I'm not sure. I'm not aware that there is a salary cap on the COVID pay incentive bonus.
Ms. Lynch, is there a salary cap?
Good afternoon, Terry Lynch, Acting Chief of HR at Wang Nui Hospital. Senator VLA, just a point of clarification. You're asking the question about the COVID incentive pay.
How many incentive pay the hospital is eligible for?
If I may, there are two separate projects that we're working on for funding. What Mr. Cook is answering your inquiry.
Just tell me the two.
The COVID incentive pay, and then there's the premium pay. So the premium pay spoke to the limit in salary, the salary cap, the COVID,
which is 70,000.
That is what was, yes.
So a lot of your nurses would not be eligible for the premium pay, correct?
Yes, if that 70,000 cap is maintained, yes. Yes,
based on the information that you have from OMB, I mean, people just need to know what's going on. Based on the information, the bulk of the nurses will not be eligible for premium pay because the bulk make more than 70,000, correct?
Correct.
Okay. So the COVID pay, now that's a negotiated amount that you negotiated with OMB?
With regards to the COVID pay,
yes.
We have submitted our proposals back to OMB. We've submitted several different variations. We needed some clarification on some of the requirements, so we've resubmitted that. And again, working collaboratively both hospitals.
Okay, so hold up. They did not give you those requirements before you made your submission? They did not tell you this is what, this is the range, this is how they qualify? Did they provide you with the parameters for the COVID pay?
I would say yes, they provided us the parameters. And we, I think we needed to, we didn't follow the parameters as closely as what we needed to. So we had to come back and readjust and make some adjustments to our submission.
Have OMB or the executive branch given you a timetable as to the COVID pay, agreeing and paying it out?
Not as of date.
Not
as of today.
Okay. And I'm saying that because those are frontline workers. they really didn't have a choice as to whether or not they go to work as soon as COVID hit. Before any vaccination, they were on the job. And I can't understand how 2 years after, 2 years and 2 months after, we have not made a decision on COVID pay for our frontline employees who are there in the midst of COVID before any vaccination. I can't understand why it has taken 2 years and months and we still don't have a timetable. That's not the way that we retain employees. Not when they're hearing and seeing employees throughout the nation, getting bonuses here, bonuses there. I really hope that we speed it up, and it's not up to you, so I'm not blaming the hospital. But I am hoping that whatever plan that you submitted, that it will be approved and we'll be able to move forward. I recently was at the hospital and had a chance to speak to some of the employees, and I spoke to some ladies in housekeeping, and they were asking about the premium pay. And the one lady told me, and it really rang a bell in my head listening to her. She said, you know, we're always forgotten about in housekeeping. But when a COVID patient moves out the room, housekeeping has to clean the room. And sometimes we're so scared that we use so much bleach and everything else because we don't want to be infected, that we almost passing out in the room because we want to go home to save to our children. I make $13 an hour, barely. That's what she told me. I make $13 an hour. Can you explain to me why up to now, those of us who are on the front line from March of 2020 have not received premium pay? Are we not important? And I really didn't have an answer for her. So we got to look at the ramifications of not rewarding individuals who have kept this island safe and who have done their best to provide quality health care and all of the other services that go with quality health care. We really got to. So this isn't for you. This is a plea out to whoever is handling the premium pay, OMB, prioritize the hospital. The hospitals should be priority. Human services are taking care of disabled children should be priority. Taking care of our seniors should be priority. We had this conversation back in February. I'll conclude, Mr. Chair. In February, we asked OMB when government workers are going to be paid. They said the next month, and then the private entities, supermarkets, would be a couple months after. This is now May going into June. Nobody can get paid. Thank you so much, Mr. Chair. I didn't get to ask my other questions. I'll ask it on the second round.
Thank you very much, Senator Viale. Before we go on to Senator Sorrow for her 7 minutes, Mr. CEO and I guess the Director of HR, what is your understanding of who will be eligible at the Wang Louis Hospital for the premium pay?
Good afternoon, Terry Lynch, Acting Chief of Human Resources, Wang Louis Hospital. According to the guidelines that was submitted to the hospital to work on that project, the understanding was there was a cap at 70,000 for qualifying individuals, but to piggyback on what Mr. Cook submitted, we did submit all individuals. There was a time period. The time period is from March 2020 to March 2021. And every single employee that worked during that time period at Wang Louis was submitted for consideration. I cannot officially say because there hasn't been anything received from Mr. Cook or myself regarding employees and frontline workers working over 70,000, but I do know that it is being considered by OMB as well because that was the conversation about perhaps. And so I'm saying this unofficially. There was a conversation about employees that work over 70,000, and there was a consideration for exemptions for healthcare workers, specifically for Wang Louis and Schneider, but we have not received official feedback from OMB regarding that.
So based on your submittal, everyone that worked between that period of time, March 2020 to March 2021, was submitted?
Every single JFL employee.
Very well. Senator Sorrow, you recognize for your 7 minutes at this time.
Thank you, Mr. Chair. Good afternoon to all. Good afternoon to those listening or viewing. Mr. Cook, this is not for a response, but about 2 or 3 years ago, and recently I visited the Wang Louis Hospital, and I could attest to the fact that your security does fall asleep at their post. I'm not asking, I'm a primary resource, and I'm telling you that that happens. And of course, the article was printed. I didn't find anything in it to be. I'm not an attorney, so I don't know what would constitute really a HIPAA violation. But the security should be amped up at the Wang Louis Hospital. And then that person that's in the article discussing the breach was terminated at a time when there's a shortage of nurses. So I'm a little appalled at how that situation was handled, because and then on top of that, you know, you claim that you had an investigation and the information was false, but then you have the office inundated with phone calls of those who work in the emergency department who confirmed the situation and were indeed shaken up. But, you know, I'm not here to debate your decision, but I am concerned about your decision with a particular employee, because the story was corroborated by a few people, and I know for a fact security does fall asleep. So that, you know, that needs some attention. Let's move to the board. Nurses, has the board responded to the union to meet and discuss salaries or bonuses? Have you responded to the nurses union, Mr. Finch?
Thank you, Chris Finch, chairperson of the Territorial Hospital Board. Yes, in pieces, the Office of Collective Bargaining has started the process with some of the nurses' unions, and they have scheduled for the other one or ones that they had not started with. I've also had conversations with the Commissioner of Health, because they're part of the same negotiation. And next week, we have both Finance Committee meetings at the Territorial Board and full Territorial Board meetings, and these are a topic for those meetings as well. So I've talked.
So you tell me about collective bargaining, but I just wanted to know, has the board responded with, we are in the process, we acknowledge your correspondence? Have you done any of that with the unions?
The board has not. We're waiting to make some decisions at the board meeting next week, but we've told the Office of Collective Bargaining that we want to engage in the process so we can settle these. We want to do the negotiations.
Okay. Now, Mr. Cook, how are your gas levels? Are your gas levels up to par at the hospital?
Good afternoon. Thank you for the question. This is Doug Cook, CEO of Jfl Hospital. When you're referring to gas levels, I would assume you're referring to oxygen levels. Currently, our oxygen levels are at a rate that is appropriate for the consumption and demand that our facility is using. This is something that is monitored on mostly a daily basis to a weekly basis, so that we can anticipate our resupply coming from off-island sources.
Okay. Bathrooms outside of course you have to use the bathrooms outdoor. What's the plan? I know, of course, we all know the hospital is slated for demolishment and to move into Jfl North. But is there like an interim plan as far as these bathrooms are concerned, or is that just the way it is until you move into Jfl North?
The interim plan, or the current plan with regards to the continuation to ensure that we have the right amount of oxygen supply, is currently being carried out. And this is basically aggressive.
No, I'm talking about, I'm done with the oxygen. I'm on bathrooms. I asked about bathrooms.
Okay. You're referring then to the bathrooms of the emergency room. Is that correct?
Yes, I asked a lengthy question. I think you missed the whole thing, so I should reclaim at least 10 seconds. But I'm asking about the bathrooms. Do you plan to continue with the status quo regarding the bathrooms, or is that interim plan on this bathroom situation?
Yes, the current interim plan of utilizing the unit outside of the emergency room is going to be the continued plan. It would not be feasible to dig up the entire, we would have to shut down the majority of the entire emergency room to accomplish something that wouldn't even be accomplished before our planned move to JFL North.
Okay. Now, on page, it's not, line 170.
1 minute.
So JFL recognizes the need to augment revenue in an effort to stabilize the systems that are key to delivery of quality patient. You recognize the need to augment the revenue in an effort. What is a plan? Do you have a plan?
Yeah, yes, we do.
Beyond
And
recognizing. Go ahead.
excuse me, Doug Cook, CEO of JFL Hospital. We are currently working on a plan to be able to increase our access, which will ultimately increase revenue to key areas, those being surgical services, those being radiology services and laboratory services. Those plans are continually met with challenges such as staffing levels, so we continue to change our plans to make the best opportunities possible.
So here's a question.
Yep.
Here's a question. So while you recognize and the plan continues to change, have you had the opportunity to implement some immediate change to rectify the issue on the revenue generation?
Yeah, so one of the recent changes or one of the recent plans we've done is to increase the number of OR techs that we currently have so that we're able to provide more surgical services capacity. And that was done by bringing in additional OR technologists through a staffing agency.
Okay, Mr. Chair, I don't know if my time has been called, but can I ask a question? I didn't hear time.
Your time was
time
called, Senator,
called?
but you may wrap up. Go ahead.
Oh, thank you so much. Ms. Lynch, so the testimony on line 222 says that you have a very close relationship with the UVI School of Nursing, have engaged all 14 of the recent nursing graduates. I'm happy that the relationship is improving because we did not engage our nurses timely before. What does engagement look like for you as an HR professional? Is engagement a phone call? Does engagement constitute a virtual meeting one day telling the nursing graduates the next steps, who can help them study for tests, blah, blah, blah? What does that engagement look like so that we can ensure that we at least capture 80% of these 14 graduates?
So specifically regarding the 14 UVI graduates, engagement took place in the form of an in-person welcome and recruitment reception that occurred during Nursing Week. All 14 graduates attended. They had an opportunity to engage with each nurse leader at Wang Louis. They got an overview of all the specialty areas so that they could choose which specialty area that they would be interested in. The executive team, including myself, Mr. Cook, the chief nursing officer, and Ms. Hazel Filbert, we all addressed the graduates in person, introduced ourselves, offered what resources and support we offer within the organization. In terms of what are the next steps, what was shared with them was the employment and onboarding process, the documentation that was needed to expedite the process. Support was also offered, which supported them through the nurse licensure process. And I am very happy to say that post-graduation, out of the 14, we currently have 6 applications for the graduate nurses.
Thank you, Mr. Chair, for the latitude.
Thank you very much, Senator Sauro, and thank you for that question because, in fact, we have long advocated for that type of engagement and interaction. So I commend, the JFL HR as well as the CEO because that is something that we spoke about even when he came on board. That we wanted to make sure that we see some engagement with those graduating from our nursing program. So I'm happy to see that that has moved forward, and I know that. If you continue to engage them, that 6 could actually improve a little bit more because I think that the delay is what caused the fallout, and those others will go to private areas or whatever. But continue to be at it, and I'm sure that you can improve that number from significantly, perhaps even double it. So kudos to the team on that one. Senator James, you recognized for your 7 minutes at this time.
Good afternoon to the people of the U.S. Virgin Islands. Thank you, testifiers, for being here. In the 33rd legislature of the Virgin Islands, if I can recall correctly, there was a mentioning of a program to fast track the amount of time visitors have to wait based on a digital software or something of that nature. Are you familiar with that, CEO?
I am not.
When there was a transition from the last CEO to you, did you read any documents that speak to a system that they're going to put in place, a digital system, so when individuals come in, they can sign in, they know exactly who they're going to see and what have you? It was made mention in a testimony of CEO Diana Williams.
You may be referring to the Meditech Expanse program, which is a upgrade to our EMR system that will greatly improve the access and ability for at every interaction of the patient service model while they're in the bed, but also as they enter the organization and register to the organization. That will be greatly enhanced if and when we get the Meditech Expanse upgrade.
So what is needed? Because if I'm not mistaken, we were told that it's fully funded and it should be up and running. Do you have any details for us on that?
Yeah, I want to make sure, again, Doug Cook, CEO of JFL, I want to make sure that we're speaking of the same product. And if we are talking about the Meditech Expanse program, it was fully, we purchased all the hardware, we purchased all the software. We are still waiting funding. We need about $6 million for the consulting services that are needed to come in and be a major part of the implementation and training of that program. I would acknowledge we have Greg Bryant, our Chief Information Officer, sitting to your left that might be able to answer that question further.
Please, briefly.
Afternoon, better. Okay. Greg Bryant, CIO GFL. So yes, Overseer Cook was saying, we are waiting for funding for consulting services for the Meditech Expanse. The hardware is purchased along with licensing, but because of the size of a hospital staff, we do not have the human capital and the expertise on island to execute that implementation properly. And with Expanse, this is something you don't want to get wrong the first time, so you need to do it the proper way.
So in the meantime, what are we doing to improve on our wait time for individuals who are receiving services at the JFL hospital, excluding what we just spoke about?
We are continuing to use the Meditech system that we currently have. It just has less functionality than the expanded program.
Okay, understood. And when it comes to our finances at JFL, as far as our obligations to the vendors, how are we going about paying our vendors, and what is our outstanding amount, if anyone can put that on a record?
Doug Cook, CEO for JFL. I would acknowledge Rosalie Javois, who is our interim executive vice president for finance. Rosalie's been with us for a few weeks now. I'm not sure if she has that exact number, but I will ask her that. As of my tenure of 5 months of being here, we are current with all current vendors, but we do acknowledge that we have a listing of vendors that from the past that we owe money to. Rosalie, do you have any of those figures with you?
I'm sorry, operating at a disadvantage not having my hospital equipment with me.
No problem.
But it's
No problem.
what
No problem. In the essence of time, through the chair, I'd just like to request documentation that speaks to our standing vendors, and so we can be able to find out what's the status of your finances, because we know that in the past, based on the past hearings we had, there were a cash flow issue with the Juanif Louis Hospital. And there was a press release that was sent out on December 6, 2021 from the JFL team regarding the medical debt relief program for patients. Can someone provide us an update of how well that amnesty program went along to improve your finances?
Yes, you're referring to the amnesty program. I do not have the financial outcome or the money that we collected with me here today, but that is definitely a number that we have calculated. We've provided to the board already. We'd be happy to submit that as a follow-up to this.
Yes, through the chair, we'd like to receive a status update on the progress of the medical debt relief program that was made mention in a press release on December 6, 2021. I want to make sure before I get down to any of the pressing issues that we focus on the finances of JFL North, because we know it takes money to run that institution or that establishment. Also, there were issues in the past regarding the procurement process at JFL that led to some findings in the Inspector General's audit. My question is, who is the current Director of Procurement at JFL?
Our current Director of Procurement is Rochelle Lewis.
And she came on board what year? Anyone?
No, I met her there in 2019, Senator. That's all I can say. I don't know if Ms. Lynch knows.
Okay, so my follow-up question would be, through the chair, I'd like to request the up-to-date organizational chart for the JFL management team and the board, so you guys have a general understanding of who to contact in the future for basic things. Because the reason why I'm asking this when it comes to the procurement process in the Inspector General's audit, it showed that the hospital did not have a contingency plan to ensure that they acquired the proprietary information held by top-level managers when the employment ended. And it was also referenced a situation where the former legal counsel, who was terminated in October 2017, had access to the password. And when they left, it basically left our JFL management team in shambles. So as far as a contingency plan moving forward to make sure those things do not happen so individuals can hold the people of the Virgin Islands hostage, can you speak to what plans are in place?
That is, Senator, the board asked both hospitals to implement a data collection system, and Microsoft 365 and SharePoint are the intended solutions.
I do not want to abuse my time, so I will wrap up in fairness for my colleagues to ask their necessary questions, but I'm very interested in the finances because moving forward for JFL to do well, we need to know the financial health of the hospital. Thank you, Mr. Chair, for the time. So I look forward to those requested documents.
Thank you very much, Senator James. Senator Carrion, you recognized for your 7 minutes.
Good morning to my colleagues. Good morning to the testifiers, and good morning to the viewing and listening audience. Afternoon, yes. My day has been very intense. Good afternoon. Well, we're here talking about the status and this audit and the status of the hospital. I do have a few questions with regards to audit report. One of them is in the report it speaks about that the hospital has lost revenue due to patients being flown off island for services that would be usually performed at the hospital. Do we have an idea of what that lost revenue is? Do we have an estimate amount? Because I would love to hear how much do we think that we're possibly losing?
Chris Finch, Chair of the Territorial Board, if I can take the first stab, because I asked that same question and the Finance Department was not able to provide a number.
Okay.
If I may, Senator, although we know the pieces that lead to that, for example, when we have fewer operating rooms, more surgeries have to be sent out, et cetera. When we don't have enough radiologists, more radiology work has to be sent out. So we know the pieces that lead to that loss. But I guess in a way it's hard to collect a negative that no one has come up with a dollar amount.
Okay, so we have
Doug Cook, CEO of Jfl, just to add on to that. It's hard to come up with and give you an accurate figure since many individuals on the island decide to go offline or off island for their services that we don't even know about. So again, it's hard for us to track what that dollar figure is.
And those that have been transported by the hospital, that have come to the hospital for services, but those services are not able to be provided by Jfl. Do we have a number for those, or it's the same case?
I believe it would be the same case, this has been going on. I don't know how long. When I was at Human Services, I used to sign off on all the Medicaid payment for air ambulances, and that was every week that there were cases on both islands. There will always be some services that a hospital serving a community of 50,000 people would not be able to do because there won't be enough work to keep that specialist. But the basics we want to be able to do and keep that revenue here, and it's easier for people as well to be able to be treated in their home island.
Of course, and for the family members, for many reasons, relatives and so forth. And it's really been causing a hardship in many families having to have their loved ones be transported off island to seek medical attention. CEO, you want to say something?
Yes, thank you, Senator. While I don't have financial figures for you, what I do have is numbers. In 2019, there were 389 transfers off island. In 2020, there was less. There was 248. In 2021, there was less. It was 231. And actively in 2022, from January to March, there were 75.
75. So we're seeing those numbers over the years declining. In your search, do you know why the numbers have been declining?
Yes, the over 50% of the transfers off island are related to cardiac and neuro services. Neuro services, we don't have brain surgery. We don't have a lot of those type of services available here. Cardiac services, we lost our interventional cardiologist several years ago. Haven't been able to recruit one, so that would be a large portion of those number of cases.
All right, now we know that the findings for the audits are a bit troubling, but the chairman for the board, Mr. Finch, you have assured us that the board and also executive team within the hospital are doing everything in its power and put some measures in place to mitigate and avoid some of these things from being repeated. Is that so?
That's correct, Senator. Chris Finch.
2 minutes.
So some internal controls have been put in place. Then what about those decisions where management doesn't follow or hasn't followed in the past what the board has directed to do? How are you planning to deal with that in the future if an event, something happens that goes through without the board's approval?
Senator, it would be so reliant on that situation. I don't know that I can give you a good answer to what specifically we would do, but I will assure you that we are doing everything we're able to do in terms of systems and processes to not make that opportunity happen. I believe from all that we see that current management in both hospitals has welcomed the involvement of the board in this decision making and sharing the responsibility for the decision making.
Yeah, Mr. Chairman, and if it does happen and you have someone within the executive team or the management team that has violated something that you have established in your process and procedures or your procurement process, what will be the consequences? Because what we continue to see in this government is people get away with things and there's no consequences or penalties. And then you see others just doing the same thing and nothing happens. So what's the board position if anything similar happens in the future? And how can you assure the community of St. Croix that the board will exercise its responsibility of accountability?
Senator, let me answer in this way. Both CEOs have contracts, and there are clauses in the contract of what's expected of the CEOs for continued employment, et cetera, and following the board policies is an item in those contracts.
Well, we hope that what has been put in place, internal controls, would avoid any further situations like the one we've seen in the past.
And Senator, if I may for just 1 second, when I spoke earlier that concern led to a change in the CEO, I was talking about 2017 and not recently. I just want to be clear and put that on the record.
Thank you, Mr. Chair.
Very well, thank you. I'm sure that's important to clear up, so thank you for that. At this time, Senator Francis Heiliger, you're recognized for your 7 minutes.
Thank you. Good afternoon to my colleagues. Good afternoon to the staff, testifiers, people of the territory. First, I would like to say that as we celebrated African Liberation Day, African Day today, I was very happy as we continue to deal with understanding the unity of Africa and the rationale and reasons why we even celebrate this day as it regards to their efforts to push back against colonialism and the apartheid situation. Now, the first set of questions I want to ask has to do with the $1.4 million that was spent on retrofitting these trailers. Have you guys done anything to potentially try to recoup any of these funds, or is it a dead case, completely lost to us?
Thank you, Senator. Chris Finch, Chair of the Territorial Board. The $1.4 million was spent on vendors who did what the hospital asked them to do, so there is nothing to recoup.
Okay, so the other states benefited from that. So, okay, thank you. One of the things that was discussed quite a bit here today has to do with accountability. And I wanted to know, with some of the equipment, have you guys done anything to find out if any of these equipments are regulatory compliant and can be utilized before purchases so that mistakes don't happen? Do we have policies in place now so that mistakes for purchasing the wrong equipment doesn't happen and then it's a loss to us?
Senator, this is Doug Cook, CEO of Jfl Hospital. Thank you for the question. As part of our procurement process and part of our intake process for all medical equipment, once it's received within the organization, before it is allowed to be put into service or to be used with the patient, it has to be inspected by our biomedical team or other teams to ensure that it is functioning as designated and designed so that we can ensure that, as you stated, that it is operating correctly.
Okay,
Senator,
thank you.
May I buttress that with just a little more information? The board attorney for the Territorial Board has created standard contracts for supplies, for equipment, for services. In virtually every possible case, we require the vendor to use our contract rather than saying using their forms. And these are built-in requirements into our forms.
Okay, thank you for that additional information. As it relates to when it comes to some of the monies that were lost due to not following protocol, non-approval of contracts, et cetera, has the organization done a total assessment to see how much funds were lost so that we could see exactly how utilizing this policy that you guys have just created or implemented so that these things won't happen again? Have you done an assessment of the total loss?
No, Senator. Chris French again, Territorial Board Chair. If I understand the question, the answer would be no. In the month that we've had the audit, my focus at least, and I believe I speak for the whole board, has been, are we sure going forward we are not going to experience the same problems?
Well, I think for me as an individual that, you know, with dealing with business, there has to be some kind of assessment as to what the mistakes were and put a dollar value to it. Because for us to say it happened, and I'm here listening to the responses of many of the questions that my colleagues asked, and I'm hearing things, nobody know who's going to be held accountable. How is somebody going to be held accountable? So what I'm hearing today is, I'm not sure if anybody's going to be held accountable. We don't know how much money we really lost, but since this happened prior, we're just only concerned about what we're gonna do in the future. But I have learned, whether you're dealing with government or private business, you have to know exactly what your mistakes were so you don't repeat them. Not know that they exist, but you have to identify. And especially when it comes to a dollar value, I would think that's very important for you guys to follow up and know, well, hey, we lost 2, 3, 4. I think that's very important, and that's my thought process. When it came to the Inspector General's report, they had a concern in regards to the competitive bidding. And I know there were some questions along those lines. Could you give me a little bit more in depth as to how some of the policies would potentially curtail any issues that might have happened in the past, so I can better understand how this won't happen? I understand you keep telling us about the policies exist, but could you give me an example of how this will take place?
2 minutes.
Senator, I'll start at least. Chris French, Territorial Board Chair. For the larger procurements that come to the board level, particularly at the Finance Committee of the board, members are provided a bid file. The bid file shows the RFP that went out. It shows the advertisement for the RFP. It shows obviously the scope of services that's in the RFP. It shows who responded to the bid, the prices, the members of the bid evaluation committee, their individual scoring of the bids that came in. In the cases where there was only one bidder, questions are asked about why, if that's at all known, or in cases where there's only one possible bidder, the hospitals are required to write a justification memo. And you know, in some of these cases, it may be that the equipment was, you know, borrowed from Acme, and Acme has a single, you know, certified service contract that covers the Virgin Islands, so we have to use that service provider. But whatever it is, when there is not an opportunity for competitive bid, they're asked to write a justification memo, and both hospitals are using some group purchasing arrangements that are being used by numerous hospitals in the States that also works on getting better pricing.
Well, thank you so much for that. I'm not sure if my time was called, but if it was, Mr. Chair, may I ask the final question?
30 seconds.
You have 30 seconds, and then you may wrap up, Senator.
Thank you so much. The last question I'll ask in my time frame has to do with competitive bidding and dealing with competitive grants. As you know, we are aware the hospital do get grants, but under the last infrastructure bill that was passed by Congress, can you share with me any type of strategies or plans that the hospital is going to be utilizing to attempt to go after any of those competitive grants in order to assist the hospital financially?
This is Doug Cook, CEO of Jfl Hospital. I don't have a exact plan of going after specific or how we will go after. We are constantly evaluating all grants that are available or opportunities to apply for grants and selecting those that we feel that we can meet the challenges of and support to help the organization, but ultimately to help our patients in the Virgin Islands.
Okay. Thank you, Mr. Chair. And I just want to make one final note. I wanted to send out condolences as we battle here in this territory our own issues against gun violence. I wanted to send condolences out to those in Texas on the unfortunate loss and murder of those children and adults and educators in that state. Thank you so much, Mr. Chair.
You're welcome. We did have a moment of silence earlier, again recognizing that. So thank you for that. Just real quickly, I just have a few questions and then we'll go to a break. How many nurses have been separated from JFL since January to now?
Terry Lynch, Acting Chief of HR, Wang Louis Hospital. For the year of 2022 to current, we have had 8.5 nurses separate. The 0.5 would indicate either part-time or per diem employee.
And 2021, you have the information of 2021?
For 2021, we had a total of 20 RN losses, separations.
Very well, thank you. And you down by how many?
Say that again?
How many are you down by? How many vacancies do you currently have for RN nurses?
Currently, our vacancies for nursing, I believe, let me find that, is 73 bedside RN vacancies.
73, very well.
73 RN bedside vacancies.
Okay. And I know that we just celebrated Hospital and Nursing Week, and in fact, there was a nice reception, again, honoring the Nurses of the Year, Employee of the Year. What is your morale like? What would you say if you had to give a grade to the morale around the hospital right now? What would that be?
Doug Cook, CEO of JFL. As I mentioned during my testimony, I spent hours meeting with every department who showed up to be part of it, and we talked through many of challenges. The morale is low. I don't know if I can put a specific grade on it, but the teams here have gone through significant battles during this COVID pandemic, and they have worked tirelessly, and I can't thank them enough for everything that they've done. The doctors, the nurses have endured so much through this, and working in a damaged facility causes more and more strife to their day. And so the morale is low, but we talk candidly and transparently about what we need to do to change that. And we talked candidly about giving of ourselves and putting our patients first. Our patients deserve to come first always. And that we're called to serve in this type of healthcare. And as we do that, we go through challenges, and we're going through one of those challenges right now.
So CEO Cook, give me 3 areas of focus that you believe that will be critical as you start to see the uptick in morale. What are those 3 areas that you will focus on?
Number 1 is people. People are the most important thing that we have in this organization. Whether doctors, nurses, whatever it is, people in this organization are our priority, and they need to feel valued and respected. The second one is quality. We need to ensure that everything that we do at JFL, we are putting quality of care at top of mind. The third is customer service. We need to make sure that everybody who enters the doors of JFL is welcomed, appreciated, and they get the type of service that they're looking for. Not the type of service that we feel they deserve or that type of service that we want to provide that day. It's the type of service that they demand and that they deserve to have.
Very well. I think those are 3 very important areas or qualities that need to be focused on. JFL North. I believe many people have tuned in to listen to this hearing today is very concerned where we're at with JFL North. You have a Herculean task Mr. Smalls, and I know that we're banking on you, we're betting on you, we're praying for you that we're able to deliver the JFL North to the people of the St. Croix over the next few months. And I know that you talk about equipment that's already on the ground, and you and I speak quite often and try to maintain an update. We have equipment on the ground, and we do have an order and everything already. So you're pretty settled and satisfied that come August that we will be able to at least complete the infrastructure of the CMU building for the JFL North.
Thank you for that confidence. And yes, that is our goal. That is our objective. That is what we work for. As I tell my team, 8 days a week, 25 hours a day. We have a mission and we want to get it accomplished.
Okay. And in regards to the CMS certification, Mr. CEO and maybe the chairman, I don't know if you're involved in any discussion in respect to how then do we certify or get the CMS certification for the JFL North. Can you speak to what's being done in that area?
We've the way the CMS works with regards to their certification of new facilities is really that they expect to come out and survey a completed hospital that meets all the levels of their certification, all their requirements. And it is up to the institution to ensure that that is done. So we actually are able to, and I had a call with CMS as early as last week to start talking through the process with them of what certification it looks like. And obviously, we're going to be sharing with them our transition plan. It was in our testimony. We have over a 600-page transition plan with them. They want to have some reassurance that we're working towards that. And once we get to that and what our date, they know that we can't give them an exact date yet, but they want to anticipate a date. Once we get that to them, we really have the ability, once we've met all other local authorities and requirements to gain occupancy of the building, we have the authority to move into that building. At that time is when CMS will be notified, and they will at that time come out to survey us.
Okay, so having said that, then there's nothing preventing us once we have the infrastructure completed for moving into the building. The certification takes a little bit more time in terms of getting that done. What does it mean for CMS to do the certification? Is it funding? What is necessary for that CMS certification? What do we get by the CMS certification, for the public certification?
Sure, every hospital that is CMS certified is able to participate and receive funds from Medicare and Medicaid. Most all other insurance providers follow the same suit as those organizations.
So I have this idea that I've kind of tossed out to you before, but in the interim, because of the critical state that we're in, because this is a primary facility, is because we can't continue to wait. Is there an opportunity then, to at least be able to fund whatever that cost will be in the interim until such time as we could get certification? Because again, we can't here in St. Croix. There's no way that we can continue to take a delay. Beyond August, I believe it's critical that we're making some steps to move into that facility. You have a transition plan. You have some timelines established for the move-in and everything like that. But beyond that, until if CMS decides to take another 90 days before they do certification, where are we? What can we do as a government? What can we do as a legislature to support us being able to at least get that facility up and running in the meantime?
Thank you for the question. This is Doug Cook, CFO of JFL. To answer your question, there is more involved than just the financial aspect of it. In working with CMS in many organizations, they provide the sense of acknowledgement and confidence that we as JFL or any organization are able to maintain the standards that they set forward to ensure that quality is being adhered to for all of the patients that we serve. So there is the quality component that they very much ensure that we are following.
So having said that again, I believe that then we need to take this discussion up to a higher level then. We should be going to CMS headquarters. We should be going to Washington, D.C. if we need to be able to have that conversation, because again, I think it's so critical for us to be able to get this JFL North up and running for the benefit of all people. I think we need to escalate the discussion, not just at this level and just talk to CMS here, but really take it to the higher level where we could be able to speak to those individuals that could expedite.
Yes, I would agree, Senator. At every level that we've had discussions so far, CMS has been a great partner for us. But we do need to, as you mentioned, the critical nature of getting JFL North open for this territory is paramount, and we need to make sure that we're taking all avenues possible to ensure that that happens.
Very well. This time, we'll take a 3-minute recess, and when we come back, we'll do a quick rapid fire so that we can get on to Block 2. The Committee of Health, Hospital, and Human Services stands in recess for 3 minutes. We're out of recess again today. We have joint block number 1. We have the Committee of Health, Hospital, and Human Services, have the Governor Juan Francisco Louis Hospital, as well as the board chair, Mr. Christopher Finch, here where we're doing an update on JFL as well as JFL North. Before we went to the break, I had a question in regards to what will it take for us to be able to move into the JFL North once the CMU building is completed, as well as while we await the CMS certification. Your response, you have some follow-up to that, Mr. CEO Cox?
Yes, I just want to make sure I'm clear. As we're going through this transition process, we are in continuous communication with CMS, and it is our goal that as we provide them the transition plan and our expected move date, that they are also coordinating on their end, that they will be available and on site on that day or very shortly thereafter to complete their certification of our building.
Okay, very well. Very well. We'll go to a second round of 3 minutes. So, colleagues, if you need it, use it. If you don't, then we could just move on so that we could get to block number 2. Senator Blyden, you're recognized for your 3 minutes at this time.
Thank you, Mr. Chair. Good afternoon again to my colleagues and viewing and listening audience. Board Chair Finch, I'm going to go back to your testimony quickly, and please be succinct with your responses. And you spoke to 3 findings from the IG office. And the first finding, number 1, was internal controls. And the OIG determined that that finding was resolved and partially implemented with a need for continuous monitoring. So who will be doing the continuous monitoring from the board's perspective?
The board.
Okay, very well. Fine, let's go to finding number 2. Finding number 2 was questionable management decisions, and the board's response to that was the second finding as resolved but not implemented. What the time frame in terms of implementation?
There were 2 specific findings under that category. One of them that, in our opinion, is resolved because that was the creation of the hospital redevelopment team when it asked about having professionals to oversee capital projects, and that's what that is about. The second one, it had to do with the hospital adequately planning its procurement. So that is an ongoing process. We believe we're doing that now. One of the things we know we need to do that is not completed is have capital budgets, multi-year capital budgets for both hospitals, and that's something we'll be working on over this next year.
Okay, so by the end of this next year, you should have that completed, you feel? Okay, and finding number 3, frequent management turnover. And it was recommended that it was resolved but not implemented pending verification of any changes to policy and procedures. Okay, what's your response to that one?
The 2 responses, one internal to the hospital of working on succession planning, and then the board requests that the hospital create a data collection system, and that's the Microsoft 365 and SharePoint, that will have multiple user access so information won't be lost because one person has a password and doesn't share it.
Okay,
1
very
minute,
well.
30
and
seconds.
Is the board fully complemented at this time?
No.
How many vacancies are there on the board? Do you know?
For the district governing board, there's supposed to be 9 members. We have 4. For the territorial board, there are 15. Supposed to be 15 members. We have 10.
Okay, for the district, you say there should be 9 and you have 4.
Correct.
What does it look like in terms of district? St. Thomas, St. John, St. Croix. What are the 4?
The Juan Louis board has 4. The St. Thomas district governing board, I have to count in my head, has 3.
Oh, we got a long way to go. Have you guys reached out to the governor and see what they are doing in terms of setting our members?
We have proposed some names, yes, sir.
Okay, very well. Well, I look forward to a fully complemented board, and more progress moving forward on behalf of the hospitals and our people here in the territory. Thank you so much, Mr. Chair, for the time, and thank you for responses.
Thank you very much, Senator Blyden. Senator Johnson, you recognize for your 3 minutes.
Thank you very much, Mr. Chair. Back to the audit report. In the audit report, you say you had 189 vendors that you didn't have no contractual information on. Is this problem solved? What are you doing to make sure that this doesn't occur again?
The board has requested from both hospitals complete vendor list.
From the hospital?
From both hospitals, yes.
And if they don't, what's in place to make sure that this type of behavior doesn't happen again?
The hospitals are compliant with that.
Okay. And then, Mr. Kacha, you said you met with 70 employees over the past week. How was that meeting? And was it productive? Because I think these are the type of meetings that need to be had so that management and staff could meet someplace in the middle. It's not always going to be on the same terms, but these meetings sometimes drive that discussion and eliminate a lot of problems. How was that meeting? And
Yes, thank you, Doug Cook, CFO for JFL. To answer your question as brief as I can, they were 3 meetings over 3 different shifts and involving that number of employees. How did the meetings go? They're very productive meetings. It is not a meeting for me to stand up and go through a 30-page PowerPoint. It's me to give a few brief updates and to listen. And very open-ended questions. What's working well? What's not working well? What needs to be improved? And, I find these sessions very draining emotionally for myself because I'm taking the burden from and all the concerns that our employees have and transitioning those over into hopefully action items. And I'm very transparent with the teams to say, you know what, some of these are just do it, let's just get it done. But others are, there's a couple in here we might not be able to do. And we need to recognize that and tell them why. But hopefully the majority is let's create a plan together and see how we can move it forward. And I think it's that transparency, that spirit of cooperation that makes these productive meetings.
well, I would ask that you continue having these meetings because it could only make the working relationship with management and staff better. That's the only way you're going to break that ground and not have that separation where you have a lot of disgruntled and low morale in the hospital. These things will definitely break that threshold. So I appreciate you doing that.
Thank you.
Mr. Smalls, you spoke in your thing, you had challenges with the existing condition of soil, and that's at the mechanical unit?
Yes, this is in the area of the temporary or the modular facility.
Okay. And then do you know if there was any soil testing done before project?
Yes, there was soil testing done, but the unique challenge is, keep in mind, we are confined that the only space that we could work with is the parking lot because the rest of the area is the area for demolition. So when I say we have challenges because you're working in a confined space and where you may want to place something, you have to do mitigation to those soils because that's the only place you can work in.
I was trying to understand what the challenges was with the soil, if there was some bad soil or shifting soil or anything like that. None of that nature.
Well, I wouldn't call it shifting soil, but you have heavy structures that have to go in. So as a result, in one instance, I think we had to excavate down upwards of 15 feet, remove all of the existing soil and build it back up to be able to reach what we call 95 to 100% compactability.
Time.
And last question, if I may, Mr. Chair, to wrap up.
You may wrap up, Senator.
There was supposed to be an elevator on Wang Louis North. What's the status of that, if I'm correct?
An elevator where, you said?
On Wang Louis North.
That is in the critical administrative building. That's the 6,500 square foot additional structure. That's where the elevator goes.
All right. Thank you very much. Thank you very much, Mr. Chair.
Thank you, Senator Johnson. Senator Gittins, you recognize for your 3 minutes.
Thank you. Thank you, Mr. Chair, and good afternoon to all again. Moving right along, I shared the interim final rule with you, Mr. CEO, also with you, Mr. Chairman of the board, you, Madam HR Director, and I'll have a copy for you, Madam Legal Counsel, since you just returned. And I shared it with my colleagues as well, and hopefully we can get on the same footing and ensure that these individuals who deserve to get this premium pay is paid. Additionally, I want to go back now to the questions to the audit under management, questionable management decisions. Now, it seems like we spent about 1.4 million for a temporary operating room. Where's that operating room today?
They were returned to the states they were borrowed from.
Did we ever get to use that operating room?
No, Senator.
So we paid $1.4 million for our operating room that we never used. Additionally, it seemed like this $1.4 million does not include some $2.1 million in contract costs, which increased from $1.9 million. Who was the contractor on this? And this is on page 14 of the audit report, if you're not sure what I'm referring to. I would like that, and I'll move on. I also want to know who was the contractor that was paid over $1.3 million for an emergency project that spanned over 3 years.
Senator, I'm going to have to get back to you on who those contractors were.
Thank you. So that's two of them, and I'll give you that. I'll remind you later on.
1 minute,
the hospital,
30 seconds.
with regards to that second one, with the 1.3 million for the emergency project, the hospital management apparently paid a contractor some $23,000 to $27,000 per week to pump the sewer, when they had an offer on the table for about $450 per day for 1 month, which would have rounded off to about $13,500 a month, rather than that $23,000 to $27,000 per week. So I'd like that information as well. Now, the, excuse me, my friend on the end, is she the chief legal counsel or legal counsel?
Chief Legal Counsel, Patricia, welcome.
So with having a chief legal counsel in place, do you have a legal team, or does she have a staff working with her?
Currently, she has one executive assistant. We've asked her to come on and to develop her team as she sees fit.
And this could probably be the reason why we didn't have the information with regards to the contracts, because here it is, we've been paying prior to our current chief legal counsel coming out. We've been paying a chief legal counsel that doesn't seem to have a staff on board, and we can't find contracts, we can't find invoices, we can't find anything that should have gone through the legal counsel office. Why wasn't there access to the files and electronic records by newly hired staffers? If we have a continuity plan, then we should be able to pick up these documents within the office.
Sorry, Senator, you're directing that to me?
Well, it could be either you.
Okay.
You wasn't here, so I would prefer that the board answers so that I can know how that office is set up.
30 seconds.
It's a very good question, Senator, and I don't know the answer during this audit period as to what it was. As I've been describing through my testimony today, we have been putting steps in place to make sure that these same problems don't occur in the future.
Okay, I'll talk to you afterwards on this, and I wanted to know about the material management system, whether or not there's one in place within the office of the chief legal counsel. And in my last 15 seconds, the bathroom that's outside the emergency room, because I'm really tired of seeing people have to utilize that bathroom outside of the emergency room. Are we renting that bathroom, or that bathroom belongs to the government of the Virgin Islands?
Time.
That was in place before I arrived. I do not know if we actually own it or are renting it. We're maintaining it, but I can find that answer out for you and get back to you.
So hopefully before the chair excuses you, hopefully one of your management team that's watching, listening, can send you that information.
Absolutely.
Thank you so much. Thank you, Mr. Chair, for the leniency as well.
Thank you very much, Senator Gittins. Senator Viola, you recognized for your 3 minutes.
Thank you, Mr. Chair. And I'm looking at the IG report, and when you actually read what was supposed to take place, you know why a lot of decisions were made. Jfl North was supposed to be completed by December of 2019. But because the FFEs and the gases, etc., it has not been completed, and now the date has been pushed all the way to 2022. So almost 3 years after the projected date. This body had appropriated millions of dollars for the HVAC system at Wang Louis. We also appropriated over $4 million for the sewer repair at Wang Louis Hospital. The hurricane hit. We then got a report that Jfl North would be completed by December of 2019, and this was 2018. So the $7-8 million that were appropriated were then redirected because the monies are going to go into a building that was supposed to be demolished. So for all of those who believe that somehow this body utilized monies for the hospital that should have gone to the hospital, monies were utilized because we had Jfl North on the way. And that is a $100 million facility, correct, Mr. Smalls?
Yes, Senator.
And the maintenance is $11 million. So we have a facility that is totally equipped. It has just been the failure to be able to get it open. And that failure, Mr. Finch, you were not there, but that failure goes back to the board. Because the board ordered trailers. And the first procurement had FFEs in it. And then it was taken out.
30 seconds.
And only empty trailers were ordered. And then it took almost a year and a half to get FFEs. And the board sat on that decision forever and ever. And then we finally got that, and then they realized that they needed the maintenance building and the gases, etc. So it shows you the need for subject area expertise on the board. And that is why I passed the bill to restructure the board to have subject area expertise. And it was overridden, and then it was carried to court, challenge, and we retain what we have. But if we had subject area expertise back in 2018, Jfl North would have already been open. But we had individuals who were just appointed. And not individuals that necessarily understood healthcare. So now, we await August. But in the interim, we've been flying out 5-6 individuals every single week from 2019 when it was supposed to be open. So a decision by the board and the management costs this government tens of millions of dollars
30 seconds.
and cause the hospital to continue to decay. So that blaming on this body, because this body, I know from the time we got in back in 2015, we have allocated millions of dollars to Jfl, Mr. Kosh. In 2015, we did almost $7 million to retain certification for Wang Louis Hospital. Senator Blyden was here. So we have done our part. We are partners with Jfl. We just want quality health care, a compassionate place that people can go and receive quality health care. It's not everybody could fly off the island. A lot of our population cannot fly off this island even if you give them a free plane ride. Because they just don't have the capacity or the accommodations to stay on the mainland for X amount of time. So, Mr. Kosh, I know you've been meeting. I met with you. I met with you privately. I know that you are trying. But we must. We don't have a choice as to whether or not we need to improve healthcare in the Virgin Islands. It's a must. It's causing lives. So we must continue to push forward, and I encourage the team and everybody else that is there with you and for you to utilize the institutional knowledge that you have at the hospital, and let's get Wang Louis moving so that 6 months from now we could say we're at a better place. Thank you so much, Mr. Chair.
Thank you very much, Senator Viola. Senator Saru, you recognize for your 3 minutes.
Thank you, Mr. Chair. And in the testimony, between line 147 and 155 or 156, speaks about AdCon, quality testing, AC, all of that. Who's doing the maintenance? Who's checking to see the status of general equipment in the hospital? Or do we wait till it gets to, I mean, the hospital is in critical mode, but do we wait until equipment gets to a critical point and then we react? Who's doing the maintenance? What is the maintenance plan?
So we utilize our facility, I'm sorry, Doug Cook, CEO for JFL Hospital. We utilize both our environmental services, our housekeeping team for general cleaning of the units, and we use our facilities management team for all repairs and preventive maintenance, et cetera, related to those type of issues.
Okay, no, so do you have a maintenance plan?
I'm sorry, can you repeat that question?
Do you have a maintenance plan? You told me who you utilized, but is there a maintenance plan?
Yes, we have a maintenance plan that details out how often equipment should be cleaned, air handlers, et cetera, like that, for all of our different units.
Okay, now let's go back to procurement. The report is is really sad to read. The report, the unused operating room, it went from some 1.9 to 2.1 million. The JFL North cost us some 88, not us, but cost us some $88.3 million. Due to all of these delays, we have lack of competitive bidding, and I know your response, you hired somebody for procurement, and you're attempting to improve your procurement processes, but what immediate action items have you put in place? Because your procurement seems to be the biggest issue and the heart of the issue, along with a lack of technical expertise, and that goes for the board and to the hospital.
1 minute, 30 seconds.
Chris Finch, Territorial Board Chair. Throughout the process of procurement, I believe that it has been beefed up on every level. The specific procurement meetings, the attention of the board at committee and full board levels to procurement, the use of drop boxes for complete procurement files, the separation of duties and decision-making, and the required in writing for the scores of those people who evaluate bids as they come in, standardization of contracts, so we're not using vendors' forms, but in every case possible, having the vendors use our forms. It's just been a lot of attention to procurement over the last couple of years. I'm not taking any credit for it. I believe that started before I joined the board, having recognized the problems of the past. We've just continued to have that focus.
So let me just conclude then. Your org structure is important. Have you reviewed the org structure of the hospital? And
30 seconds.
has the board reviewed the org structure to streamline processes? It helps to increase morale. It decreases levels of chaos. Has the org structure been addressed? Because you still have acting people in positions that have been acting for forever. You're either going to replace them or they're going to be permanent. Do we have duplication of services? What is your org structure? Have you addressed the org structure?
We have not formally addressed the org structure in terms of sitting down and saying we're looking at the org structure, but the issues of acting and interim is a matter that does come up and does get looked at from time to time. We have been looking at positions between the two hospitals. So one of the focus we haven't spoken about today is that there's been a lot of effort on the board to not have Schneider Regional Medical Center and Juanif Louis Hospital run as two completely different institutions, but to the extent possible, have them share similar salaries, I'm sorry, I didn't mean to go in the direction of salaries, but similar policies, similar processes, similar major staff roles, looking at job descriptions between the two, looking in places where their synergies can be obtained by working more closely together. And so we put a lot of effort into that direction.
All right, I think my time has been called, so thank you, Mr. Chair.
Thank you very much, Senator Soro. Senator James, you're recognized for your 3 minutes.
Thank you, Mr. Chair. My question is about our certified medical assistants at the Jfl Hospital. Do we have adequate amount of certified medical assistants? And if not, how many are needed and what is being done to get them on board?
I don't have in front of me the exact number of certified medical assistants that we currently have. Sorry, this is Doug Cook, CEO for JFL. I do not have the current number that we have available, nor do I have the exact number that we need. I can tell you in almost every position, and just like every hospital across this country, we do not have the numbers that we need and are actively working in many ways to find ways to bring new people into the organization. But we can follow up with you with exact numbers.
Please do so. And as time is limited, I'll move on to the next question. I know HR 3434 was passed. Is the Territory's Health Equity Act of 2021. Ever since its implementation, can you speak to, or anyone on your team can speak to the benefits we have received to the Territory as a result of the passage of this act by Congress?
Terry Lynch, Acting Chief of HR. Can you tell me what that bill refers to?
Well, the Territory's Health Equity Act is to provide a long-term solution for Medicaid programs, eliminate healthcare disparities the U.S. territories face under federal health programs, eliminate the share between federal and local match to make sure that Virgin Islanders are receiving the same health benefits as those as their stateside counterparts. And you know, based on Title 19, Section 221 of the Virgin Islands Code, it speaks to how we go about with our payment for those who are uninsured and
1 minute,
underinsured.
30 seconds.
So I'm just asking, ever since the implementation of the Act, what was the trickle-down effect of that passage of the Act when it comes to JFL Hospital?
Senator, if I could start perhaps, Chris Finch, Territorial Board Chair. By law, the Territory has a 45% match to the Medicaid dollars, which is almost impossible for us to make. Every state of the 50 states, their match is based on their per capita income as a ratio of the national per capita income, so that the states with lower income, their matches are, say, 17%. Ours in all the territories is 45 by law. The changes that have happened recently with the federal government was first of all, after the storms, we were given 100% federal reimbursement, so we had a zero match for a period of time. Then the match dropped down to where it's 83% federal, 17% local, but that is not permanent. It keeps getting renewed by Congress, and it exists for like, say, 2.5 months at a time. There's been an additional COVID added where the federal government picked up another, I think, 6.4% of the Medicaid match. So we've had, as a territory, to pay far under the 45%. But there is no permanent solution to that yet. And when we talk about the Medicaid cliff, and you'll hear that talked about from time to time by Human Services, if we go back to 55% federal, 45% Medicaid, we will be back here asking for millions and millions of dollars.
I don't want to abuse my time. I think we're about to wrap up this block. But thank you for placing that on the record. And like I said, most of my line of questioning is just to make sure that we're in a better position when it comes to our debt, so we can move forward when we move forward with JFL, not moving into the permanent structure. So we're thinking about long-term planning. Thank you, Mr. Chair, for the time.
Thank you very much. At this time, we'll need to take a 2-minute recess, so we're having a little bit of technical issues, so we want to quickly try to resolve those issues. Committee of Health, Hospital, and Human Services stands in recess for 2 minutes. And we're out of recess at this time. Senator Alma Francis Heiliger, you recognize for your 3 minutes. Senator Heiliger? All right, while we await Senator Heiliger to get to her seat, I wanted to quickly talk about how do we counteract some of the negatives. I mean, obviously, we know of the challenges that the JFL is experiencing. How do we counteract some of those negatives? Do you have a marketing plan? Do you have a PR person, first of all?
Doug Cook, JFL CEO. We do not have a public information officer, something that we very much need. But it is, as we were talking earlier about org charts, that's one of the processes I'm well underway with, is identifying who's in what role and what should they be fulfilling. And in our previous legal counsel was also fulfilling the role of our public information officer. We are now going to be separating those duties because we have enough legal work that needs to be done at JFL that where we can split that out. So we currently have that position posted.
And obviously, in the meantime, we do have the government access channel on those different areas, where we could talk about the work that's being done at the JFL North. We could talk about the rebuild of the new facility. I think it's so critical that we start to at least put it out, because if the negative continues, and we do have challenges, that we must acknowledge that, right? But I'm saying that it's not all negative. We have some hardworking nurses. We have some hardworking employees at JFL, and I think they take a bad rap because the negative outweighs or drowns out the positive that's going on at the facility. So it's critical that we start to market, some of those positive attributes, some of the things that's happening in the affirmative, and really turn the tides there. So with all the money that we know that's coming in for the new facility. The JFL North, Mr. Chair, I think it's critical that you free up some money so that we could be able to allow for some marketing and really turn the tides of JFL. Do you agree with that?
Yeah, I'm Chris Finch, Territorial Board Chair. Absolutely, Senator.
Yeah, and of course we still have the social media component. The Facebook, the Twitter, the Instagram, and those things that you could also utilize to your advantage to really, again, counteract some of the negatives. At this time, Senator Francis Heiliger, you're recognized for your 3 minutes.
Thank you so much, Mr. Chair. I wanted to focus a little bit on one of the questions I had asked earlier in regards to possible recruitment of the 1.4 for retrofitting these trailers. And when I asked the question, you said it couldn't be recouped because it was monies for vendors. The reason, it was more along the lines of knowing that these were utilized when the states needed them back for hurricane time, and they might have requested funding. Have you had any conversations with them as to the monies that we put in versus them potentially could have gotten funding so we could have been reimbursed those monies since they were utilizing them during their hurricane situation? That was more along the lines I wanted to get an answer from. Have you had any communications to see if something like that was even possible?
Thank you, Senator. Chris Finch, Territorial Board Chair. I'll be honest, I was not even aware of the issues of the operating room trailers until the audit came out. That all occurred before I joined the board. But to answer your question is no. They were borrowed from those states through an interstate agreement that Vitema is part of, and I mean it's an interesting question. If we got an empty trailer and we sent back an operating room trailer, wouldn't it be nice if they
exactly? So
it's an interesting question, Senator.
How we could have had a conversation to potentially recoup some of that money. So I'm putting it out there so it's something that you guys can actually look at, because I would rather you make the effort than not make it at all. You understand what I'm saying?
Right. I understand. Thank you for that, Senator.
Okay. The other question I wanted to speak on had to do with the premium pay, the incentive pay for the essential workers that worked during the hurricane. And I know when it came directly to the hospitals, dealing with the nurses, et cetera, they were hands-on. What I want to know, earlier there was a discussion in regards to capping it as to who would receive those fundings, and I think it was passed. Could you refresh my memory as to what was the cap as to who would get funding if it passed? I think it was 73 or something like that thousand.
Yes, that is correct. The number that was being discussed was 70,000.
Okay, 70,000. And is that a number that was discussed with the hospital and you guys agreed to it, or was this coming down from the administration?
30
This is
seconds.
Doug Cook, CFO for JFL. That number was not a number that we agreed upon. That was a number that was given to us. Again, what we've done is submit.
Go ahead.
What we've done is submitted all of our employees that worked during the time frame that was asked for from March of 2020 to March of 2021.
And the reason why I asked that question is that I am a firm believer that when it came to those in the medical field, they did quite a bit extra. And those are the ones that had a lot to do with the hands-on dealing of COVID, especially with dealing with the patients that were critical. So I take note when I saw some of the different formulas that various states did. And that's why I wanted to know where this $70,000 came from. And is this something that, if they're insisting on, is the hospital going to push back? Because I'll give you an example. For like in one state, when it came to medical workers, they came up with a formula that anyone that made more than $85,000, they were not allowed to receive it if they did not have direct contact with COVID patients. They might have worked in a hospital, but if they didn't have direct contact with them. And if they made $175,000 or less and they had direct contact, they also got it. And that was just one of the state's formula. Each state did it differently. So I am here to advocate for those in that 70 medium, because when you are in there putting your life on the line, when this thing came out and a lot of people didn't know about it, and we were just moving along, to now be told that your work is not valuable just because of 70,000, I don't think that's right. And I would encourage the hospitals to really fight on behalf of their employees to see if you could get that number even higher, because I don't think it's a fair situation. That's my personal thought process on it.
Senator, your
I
time was called,
yes.
Senator,
Oh, my
quite some
time is
time
up?
ago.
Okay.
Yeah.
All righty. Thank you so much, Mr. Chair, for the additional round. And thank you to the hospitals. And I look forward to getting a more updated report, because the people of the territory, specifically St. Croix, needs these services. Thank you.
Thank you very much, Senator Francis Heiliger. Senator Carrion, you recognize for your 3 minutes.
Chair. Thank you, Mr. Chair. Let me ask Mr. Small. Oh, here you are. Good afternoon.
Good afternoon.
I know in the testimony you spoke about, and some of my colleagues have asked, regards to the mechanical room, or the mechanical building. You mentioned about that you encountered some challenges with existing soil when the foundation was being placed. So that challenge you stated in your testimony, what did it cause a delay, and like what? How long was that delay?
Good afternoon, Senator. Basically, it would cause a delay from the actual work being performed. It will be a change order, because additional costs have to be utilized to remove the existing soils, bring new soils in, compact. So those are the type of impacts that you would have in a project like this.
So in the time frame in days, when we talk about delay, what are we seeing?
I don't have that number off the top of my head, but I want to believe it's somewhere in the neighborhood of about 30 days, almost a month, because we had to, you do the study, you remove, and you have to do further studies. And then once you get the soil composition, then you have to design what you now have to put back into the ground to support the structure.
And then the change order in itself, it needs to be approved. So what time usually is that? What's the standard time for a change order?
Usually, because of the critical nature of this, when the contractor submits it, we automatically go to the board to get approval for these change orders.
Okay.
1 minute, 30
So
seconds.
you didn't require anything else from FEMA?
This particular project is based on actuals, but obviously you have to do your due diligence and provide the necessary documentation. And we feel confident that everything that we've been able to provide, the justification, the soils analysis would support the decision that we made.
So when you talk about a delay, then it's not more than 30 days?
No, well, overall contract time, you try to make it up somewhere on the back end. So what I'm saying in terms of the foundation going in, we may have been able to achieve a 30-day faster time for completing that.
Okay. And what's the projected time date for the transition of the patients that you mentioned in your testimony? So you said once the mechanical room is completed, I guess then you could start that transition, right?
Right. So once the building is completed, the transition piece encompasses what we call the commissioning, meaning now you're testing all of the systems, verifying all the systems, getting all the necessary local permits, getting your fire marshal out there, getting all your DPNR permits. Once you get all of that completed and we satisfy everything from our perspective from a clinical side, then we move forward with the actual moving
So
of the
your
patient.
target date for completion is when?
For the actual construction is August.
Is August. And then the transition period would take how long for approval and permit processing, like you're mentioning?
Okay, that we're looking at August. We're probably looking at about October, November. However, when we talk about how we streamline it, part of our process right now is how do we even get it done sooner?
Okay.
So when I say August, that's based on what we're legally contracted to do with the contractor. Any chances to expedite or move things up, that's what we're doing.
So the mechanical building could be complete sooner. And then the transition phase then would take that whole approval process, then how long would that take?
Well, that's why we embarked on the whole tabletop exercises already. So we're doing it from a tabletop standpoint, and then we'll move towards the actual. So again, those are opportunities where we should be able to gain some time.
So you mentioned a 600
30
plus
seconds.
pay transition document. Was that prepared by the JFL team, or you had a consultant outsource to prepare that transition?
That transition package was primarily done by the JFL staff. They looked at their existing facility and what it would take to move.
So apart from the staff, you had a vendor that you reach out to? Because you said primary, so there's a portion of it that's done
Oh, no, when I say
externally?
it's primarily the JFL staff, I wasn't there at the time when it was done, but from all indications that I have, it was the JFL staff putting it together.
Okay. Do you anticipate any other delays or challenges?
Right now, as we sit here today, no, I do not see any.
Lastly, the elevator, is that in place or in the administration building?
No, the administration building, that construction hasn't even begun as yet. However, that building is not going to impact our ability to move in.
Okay. Thank you, Mr. Chair.
Thank you very much, Senator Carrion. This finalize our round. Again, I want to thank JFL for coming before us today. We still have a lot to discuss, right? We still didn't touch on billing and coding. We didn't touch on unfunded care. We didn't touch on presumptive eligibility. And now there's a number of other issues that confronts the hospital. But nonetheless, we're making some progress. I truly believe that the public have a better sense of where we at, where we headed. In regards to our healthcare facility, and I think all of us wants the same thing. We want quality healthcare, we want timely healthcare, and we want our facility, the primary facility here in St. Croix, to be available and up and running in a decent manner. I believe that everyone here have that goal in mind. So at this time, I'll give each of you, the testifiers, a 1 minute wrap up. And then we'll close off this and go to our second block. Again, thank you. And we're here in a support role, as we have been, and to continue to support JFL and their endeavors to provide quality care to the people of the Virgin Islands, and particularly today, St. Croix. Mr. Chair?
Thank you, Senator. Thank you for the conversation today and the interest. I grew up in San Antonio, so I know where Uvalde is, and it struck me last night among all the horror of the carnage, the comments of how many people were taken to hospitals in San Antonio, which is 90 miles away, with the highways in Texas. That was maybe an hour and a half drive. They're a town of 15,000 people. They can't take care of all this. They have that option of going to the big city. We don't have that option. And we know that from a hospital standpoint, that we have to be the hospital that the community can count on. There are numerous challenges, as you brought up. We just touched on some of them today. But we are certainly aware of the importance of the hospital for the community and take our roles very seriously. So I thank the Senate for all the assistance that you've given us and the seriousness you take it as well.
Very well, thank you. Let's go to Executive Director Smalls, and then we'll wrap up with the CEO.
All right, thank you for this opportunity. I just want to echo the sentiments of Chairman Finch. Thank you for your support. Thank you for recognizing the inherent challenges of trying to get this building or the temporary facility underway. My team and I, along with the entire JFL staff, we take it seriously. As you talked about the public relations, that is something that's also part of that transition plan, where you're going to start to see some elements of that coming out publicly as well. But more importantly, not only do we want to be able to provide a quality facility in a timely manner, the faster that we could get folks out of JFL, the faster we could begin the demolition process and build the state-of-the-art facility, permanent facility, resilient facility that Virgin Islanders, specifically the residents of St. Croix, will be proud of.
Well, thank you, Mr. CEO. Cook.
Thank you, Chairman. I want to start by just thanking this committee for the dialogue today. We take your feedback, we take your questions very seriously, and we know that we have performance that needs to improve. And we owe that to each of you. We owe that to the citizens of the Virgin Islands. I want to pause and thank all of our employees at JFL, all of our physicians. They do a tremendous job on a daily basis and don't get thanked enough. And I would encourage all of us to remind them and thank them whenever we have the opportunity, because they put their lives on hold when they come into the hospital and care for others, and we very much appreciate that. We understand that there's many people, I think you said it, Senator, that many people can't leave this island, and they deserve to have the very best health care possible, and we need to bring that to them. In closing, I just want to say that we must ensure that we continue to put patients first in this organization and for this community. Thank you.
Thank you very much. And again, as we close off here, the JFL discussion today is that every single one of us sitting in this room need our hospital to be functional. And regardless of where we sit, where we stand, where we discuss, all of us need our hospital to be functional. Our law enforcement, if anything happened to them, they need to respond to the hospital. Our nurses, we have an elderly population. I walk on pins and needles every single night. Just thinking about being able to go to the hospital and being able to get results by it. So again, I don't try to make this a political football. It's important that we really work towards, getting it to the level that we could provide quality health here to this community. Whatever we could do from this committee, whatever we could do from this body, we're committed to make that happen because it's important. Regardless of how rich you are, you have to be stabilized before that plane could come in and get you. So all of us, every single one of us need the hospital. You have family members, we have family members. It's very, very important that we take this seriously. I want to thank you for the work that you do. Please extend our thanks as well to the staff over at JFL, that we're very much in a support role, and we want to meet with them at some point and be able to hear some of the challenges that they're experiencing and work collectively, all of us around the table, to be able to resolve this issue. The Committee of Health, Hospital, and Human Services stands in recess for 2 minutes, and then we'll bring up the block 2 and 3. Thank you. And we're out of recess. Again, today we're having the Committee of Health, Hospital, and Human Services. Madam Clerk, please go to read block number 2 and 3 into the record at this time.
Block number 2, drug use, specifically edibles in the public schools and the territory. Invited testifiers, the Honorable Raquel Berry Benjamin, Commissioner, VI Department of Education. The Honorable Justa E. Encarnacion, Commissioner, VI Department of Health. The Honorable Kimberly Causey Gomez, Commissioner, VI Department of Human Services. The Honorable Ray Martinez, Commissioner, VI Police Department. Block 3, an update on COVID-19 in the territory. Invited testifier, the Honorable Justa E. Encarnacion, Commissioner, VI Department of Health.
Thank you very much, Madam Clerk. At this time, we'll just see who's on. Representing the Virgin Islands Department of Education, I see Assistant Commissioner Victor Soames on. Can you please introduce yourself as well as the other staff that will be assisting you today on behalf of Commissioner Raquel Berry Benjamin?
Good afternoon, Mr. Chairman. Joining me at this hearing today include the Acting Superintendent of Schools for the St. Croix District, Mrs. Ericelda Atley Herman. From the St. Thomas St. John District, we have the Deputy Superintendent of Schools, Ms. Simra Brown. And at the state level, we have Mr. Irvin Mason, the Program Director for Disaster Planning and School Security.
Very well, thank you.
They represent the team here today, sir.
Thank you very much, Assistant Commissioner Soames. And representing Commissioner Justa Encarnacion, I think I see the Assistant Commissioner, Dr. Craigwell Sims on.
Yes, hi, good afternoon, Senator Dr. Craigwell Sims here, Assistant Commissioner, Department of Health. With me this afternoon, I have Dr. Tyhan Caesar, Medical Director, Dr. Esther Ellis, Territorial Epidemiologist, Deputy Commissioner of Behavioral Health, Alcoholism, and Drug Dependency, Renan Steele, Dr. Brett Ellis, Territorial Lab Director, Director Wansan Harris, Environmental Health Director. I also have Deputy Commissioner Ruben Malloy on as well.
Very well, thank you very much. And I know that Commissioner Causey Gomez have sent in a letter that we'll read at some point into the record. Representing the Virgin Islands Police Department on the behalf of Commissioner Ray Martinez. I see Hippolyte in the St. Thomas Chamber, and then of course we have Deputy Chief Cornelius and Mr. Glendrate here in St. Croix. Anyone else?
Anyone else?
Very well. So at this time, we'll start off by getting the testimony on the behalf of the Commissioner of Education. Mr. Soames, you may proceed with your testimony at this time.
Good afternoon, Honorable Novelli Francis Jr., Chairman of the Committee on Health, Human Services, and Hospitals, other committee members and senators, and my fellow Virgin Islanders. I am Victor Soames III, the Assistant Commissioner of Education, appearing before you today on behalf of the Honorable Raquel Berry Benjamin, Commissioner of Education, to provide testimony on underage illegal substance use in our public schools, specifically the use of edibles. Accompanying me today are Ericelda Atley Herman, the Acting Insular Superintendent for the St. Croix District, and Dr. Simra D. Brown, Deputy Superintendent of Schools for the St. Thomas St. John District. Mr. Chairman, I want to take a minute to recognize and commiserate on the tragic incident at Robb Elementary School in Texas. I also want to take note of the passing of a Virgin Islands giant, former Superintendent of Schools, Ms. Lorraine Gibbs. So it was important that the department recognize these two tragic incidents and bear respect for what has occurred. Moving on with the rest of the testimony. According to a 2021 report U.S. Surgeon General's advisory, U.S. Surgeon General's advisory, marijuana use and the developing brain, marijuana or cannabis is the most used illicit drug in the United States. It acts by binding to cannabinoid receptors in the brain to produce a variety of effects, including euphoria, intoxication, and memory and motor impairments. These same cannabinoid receptors are also critical for brain development and function. They are part of the endocannabinoid system, which affects the formation of brain circuits important for decision-making, mood, and responding to stress. The Office of the Surgeon General further asserts that marijuana is also commonly used by adolescents, second only to alcohol, and that the legalization movement may be affecting youth perception of harm from marijuana. Thus, there needs to be an accelerated community campaign focused on educating adolescents on the effects of marijuana use on the brain, as well as encouraging parents to be vigilant and to restrict access to cannabis products. Frequent marijuana use during adolescence is associated with the following: changes in the areas of the brain involved in attention, memory, decision-making, and motivation, impaired learning, increased rates of school absence and dropout, as well as suicide attempts, risk for early onset of psychotic disorders such as schizophrenia, and other substance use. Finally, the report of the Office of the Surgeon General in 2021 advised that no amount of marijuana use during adolescence is known to be safe. Let me repeat, no amount of marijuana use during adolescence is known to be safe. It is critical to educate youth, as well as family members, school officials, state and local leaders, and health professionals about the risk of marijuana, particularly as more jurisdictions contemplate legalization. Science-based messaging campaigns and targeted prevention programs are urgently needed to ensure that risks are clearly communicated and amplified by local, state, and national organizations. Further research is needed to understand all the impacts of THC on the developing brain, but enough is known now to warrant concern and action. In 2022, the American Addiction Centers, ACC, defined edibles as food and drinks infused with marijuana extract, cannabis-infused oils, and cannabutter, and contain varying amounts of the psychoactive ingredient THC. According to the ACC, edibles may include baked goods, candies, chocolates, and gummies, beverages, lozenges, and cooking oils and butters. Eating marijuana carries a higher risk of overdose than smoking it. Research suggests that this is because the amount of THC a person consumes can be more difficult to predict when eating marijuana compared to smoking it. And that is per the ACC. Signs of THC overdose per the ACC may include poor cognitive functioning, motor impairment, anxiety, panic and fear, agitation, extreme sedation, cardiac stress, vomiting, and psychotic symptoms such as hallucinations or delusions. The use of edibles among Virgin Islands students appears to have risen in popularity over the last 2 years as students have been at home during the pandemic. Many were unsupervised by adults for prolonged periods. The Department of Education clearly recognizes that the crisis of illegal substance use, specifically edibles, are indicative of larger issues in our community that are now manifesting on our school campuses. Thus far, confirmed reports of the consumption of edibles on public school campuses during the 2021-2022 school year received by the department are as follows. In the St. Thomas St. John district at the Charlotte Mali High School, we have 1 reported case. And at the Ivana Eudora Ken High School, we also have 1 reported case. The outcome was that those students were transported to the hospital and due process hearings were eventually conducted and offenders suspended. In the St. Croix district, at the St. Croix Central High School, there were 3 cases. And at the St. Croix Educational Complex High School, there was 1 case that was reported. The school nurses evaluated students who ingested the edible. Students had to be transported to the hospital, and subsequently due process hearings were conducted and offenders suspended. Moving forward, the Virgin Islands Department of Education will encourage, if not require, students who commit level 3 and 4 infractions of the Virgin Islands Board of Education student disciplinary policy involving possession and or use of illegal substances, illegal drugs, over-the-counter drugs, and alcohol, to participate in drug education, substance abuse counseling as part of the suspension. The department will collaborate with the Virgin Islands Department of Health for drug education for these students. Having grasped the significance and impact of the problem of illegal substance use, specifically edibles in public schools, the Virgin Islands Department of Education immediately partnered with the Virgin Islands Department of Health as a lead agency on substance abuse, and the Virgin Islands Police Department, which addresses juvenile offenses. As a result, an edibles task force was formed among the 3 lead agencies, the Department of Education, the Department of Health, and the Police Department, with support from other relevant agencies, including the Department of Licensing and Consumer Affairs and the Department of Human Services. The task force meets virtually every Monday at 10 a.m. since the edibles crisis began surfacing at public high school campuses in March of this year. These meetings are to plan and execute actions to inform and educate students, faculty, staff, parents, and the wider community of the dangers of edibles consumption. Thus far, the task force, in partnership with the High Intensity Drug Trafficking Areas Task Force, or HIDA, has participated in school-based presentations at Charlotte Mali High School, as shown in the photos included in the testimony. The initiative will begin again in both the St. Croix district and the St. Thomas St. John district at the start of the 2022-2023 school year. And Mr. Chairman, you can see in the pictures that Bobby Lucas was a guest speaker at Charlotte Mali High School. He did a Presentation during Charter Day, Character Day. He told the story of defying all odds, being born as a drug baby. Today, Mr. Lucas holds military rank and is a major fighter on the war on drugs globally. As part of the task force commitment to providing education and relevant information to students, parents, schools, and the general public about the dangers of edibles, a public outreach campaign was initiated with representatives from member agencies appearing in a series of 8 radio and Facebook Live interviews over the course of 5 days, April 5th to the 9th, 2022. Feedback from hosts and listeners showed the positive and enlightening impact of the information that was shared. Furthermore, radio commercials in both English and Spanish are currently being aired on local radio stations to further inform and educate about the dangers of edibles. Messaging will also be available in Haitian Creole. The public outreach campaign continues to be extremely important to bring about greater awareness and define what edibles are, the effects of edibles on teens and young children, and supply tips for parents to talk to their teen children. These tips are such as parents must be knowledgeable about the topic to accurately talk to their children. They must have bursts of short talks, trying not to overload your child. Choose informal times to have conversations, such as in the car or during dinner, uninterrupted time, family time. Be as clear and transparent as possible. State what you expect. Be honest about your own experiences. These occurrences are not new, and if you as a parent have experienced this, share with your child to build trust. Create family rules together, such as expectations when hanging out with friends and in some cases, family. Discuss peer pressure, developing an exit or a walkaway plan. Speak about all aspects of using to include vaporizers. Using a device called a vaporizer can reduce the risk of respiratory problems. However, safest doesn't mean no risk. Using a vaporizer only reduces smoking-related risk, not those related to the drug itself. Thus, the act of vaping is not encouraged. Consider connecting social media to your discussions. Bring it up in the context of other drug use. Be a good listener. Acknowledge your children's point of view. Use open-ended questions that encourage reflection and expression. Keep them from tuning out. Avoid judgmental comments or forced statements, forced opinions. Next steps and other actions to be effectuated by the task force include a robust social media outreach campaign and movie theater commercials targeting young people over the course of summer 2022 and into the 2022-2023 school year. School class presentations at the start of the 2022-2023 school year in conjunction with HIDA. Installation of banners and digital billboard signage around the community. Continued intense dialogue and planning with the HIDA task force. Parent and community engagement meetings and information sharing sessions to raise awareness. Student-centered activities to promote safe and healthy decision-making. And the Department of Health's training for school nurses, teachers, school monitors in identifying signs and symptoms of edible use, tentatively scheduled for June through August of 2022. The Department of Licensing and Consumer Affairs will monitor and remind hemp and CBD retailers about the illegality of the sale of edibles to minors. In conclusion, the Virgin Islands Department of Education and the Edibles Task Force intends to remain vigilant as we address and combat the dangerous use of edibles among young people. As stated earlier in my testimony, this is not a Department of Education issue, but rather one that is indicative of a larger problem within our community that is affecting our schools. We implore the Virgin Islands village, parents, grandparents, aunts and uncles, pastors, senators, everyone to get involved and play a role in keeping harmful and illegal substances away from young people. We are proud to collaborate with several government entities to tackle this matter. We remain ready and available to respond to questions. Thank you, Mr. Chairman.
Thank you very much, Assistant Commissioner Soames, for that comprehensive testimony. At this time, I'll ask media to play the video before we bring on the Department of Health to give their testimony. Media? Very well, we'll do it at the end then. At this time, Assistant Commissioner Craig Sims, you're recognized for your testimony.
Thank you, Senator. Good evening, Honorable Senator Novell E. Francis, Chair on Health, Hospitals, and Human Services. Honorable Senator Marvin A. Blyden, Vice Chair, members of the committee, and all other members of the 34th Legislature of the Virgin Islands of the United States, and the listening and viewing audience. I am Acting Commissioner Dr. Nicole Cragwell Sims of the Virgin Islands Department of Health, presenting testimony on behalf of Commissioner Justa E. Encarnacion, Commissioner who is attending the National Summit on the Sustained Management of COVID-19, sponsored by the Association of State and Territorial Health Officials, or ASTO. I have here with me today Ty Hunt Caesar, Medical Director, Dr. Esther Ellis, Territorial Epidemiologist, Deputy Commissioner of Behavioral Health, Alcoholism and Drug Dependency Services, Red and Steel, Dr. Brett Ellis, Territorial Laboratory Director, and Director Juan San Harris of the Virgin Islands Department of Health Environmental Health Division. Thank you for the opportunity to testify on underage drug use in our territory, specifically the use of edibles, as well as receiving a territorial update on COVID-19. We'll begin the conversation with underage drug use in our territory, specifically the use of edibles. With the legal commercialization of cannabis growing in the mainland US and the territories, increasing numbers of children have been reported to use cannabis in edible form or experience unintentional cannabis exposure, resulting in healthcare visits, trips to the emergency room, and hospitalization. Between April 2021 and May 2022, Schneider Regional Medical Center has seen 18 cannabis emergency abusive visits, while Governor Juanif Louis Medical Center has seen 14 in persons under the age of 21. Even though there is unintentional ingestion of THC products with the consumption of edibles, it is important to acknowledge the intentional use of THC in the underage population in varying forms. So, what are edibles? Edible cannabis products are food products either produced commercially or homemade containing cannabis extract as an active ingredient. Cannabis concentrate, also called marijuana concentrate, marijuana extract, or cannabis extract, is a tetrahydrocannabinol and or cannabidiol, CBD, concentrated mass. Cannabis concentrates contain high THC levels that range from 40 to 90%. The stronger the THC content, the higher the grade of marijuana. Unlike smoking, where cannabis is inhaled directly into the lungs and passes rapidly to the bloodstream, taking effect within minutes and possibly wearing off within hours, cannabis edibles can take hours to digest, peaking 2 to 3 hours post-consumption and persisting for many hours, which can lead to overdose. The Center for Disease Control and Prevention has warned that when young children eat cannabis-infused products, they can become very sick and can struggle to walk, sit up, or breathe normally. The Virgin Islands Department of Education has reported students experiencing high levels of anxiety, rapid heart rate, poor coordination, high or low blood pressure, nausea and vomiting, extreme confusion, and memory problems, which are all symptoms of an overdose. Further, excessive use can affect brain development, particularly true of brains that are still developing. Students can experience neuropsychological and neurodevelopmental decline, poor school performance, increased risk for late depression, suicidal ideation, or behavior. Extreme use is also associated with the onset psychotic disorder. Persons can experience episodes of hallucination, paranoia, panic attacks, impaired motor abilities, which can all lead to detrimental consequences and significant reduction in response time to action. Cannabis use in children is becoming recognized as a risk factor for adverse impacts on human health, mental health, and holistic wellness. As such, the territory's focus has always been about education and treatment around drug use, to include cannabis. The Department of Health has partnered with the Departments of Education, Human Services, Licensing and Consumer Affairs, and the Virgin Islands Police Department to better mitigate this concern. These agencies have formed a task force to build and support both preventative and treatment practices designed to combat the use of cannabis and other drugs in children and young adults through educational approaches such as enforcing regulations where these products are housed, promoted, and sold. The task force is working to establish school and community-based substance use prevention programs for implementation along with environmental interventions as part of a comprehensive prevention strategy through the Department of Health's Behavioral Health, Mental Health, and Substance Use Disorder Division. Senator, would you like me to go straight into the COVID updates, or we're breaking that up, sir?
We'll come back after this testimony, and at least we'll wrap up with that testimony. So then, before I open the floor to question it.
Okay, thank you, sir. That concludes our testimony on the portion of underage drug use. We stand ready for your questions.
Very well. Thank you very much. Media, at this time, if you just key up the audio recordings on edibles.
Do you know how edibles affect your body?
Yeah, I gonna feel good, right? I gonna just be cooling. You know what I mean? It gonna be vibes.
Okay, but do you know the other effects? The ones that aren't fun? Edibles can cause hallucination, delusions, increased heart rate, agitation, and anxiety. The difference between smoking and edibles is that edibles are digested, which can cause a delay. so you don't feel the effects right away. You think you're okay and eat some more, and then it creeps upon you, and then you're really not okay. And that is not a vibe.
What? That's crazy. I don't need no edibles then. I good.
This is Dr. Nicole Cragwell-Sims, Assistant Commissioner, Department of Health. If you or your child need more information on cannabis use in any form, please go to here2help.com or call 1-800-662-4357. Do you know how edibles affect your body?
Yeah. I gonna feel good, right? I gonna just be coolin'. You know what I mean? It gonna be vibes.
Okay, but do you know the other effects? The ones that aren't fun? Edibles can cause hallucination, delusions, increased heart rate, agitation, and anxiety. The difference between smoking and edibles is that edibles are digested, which can cause a delay. So you don't feel the effects right away. You think you're okay and eat some more, and then it creeps upon you, and then you're really not okay. And that is not a vibe.
What? That's crazy. I don't need no edibles then. I good.
This is Dr. Nicole Cragwell-Sims, Assistant Commissioner, Department of Health. If you or your child need more information on cannabis use in any form, please go to here2help.com or call 1-800-662-4357.
That is a very effective PSA. Thank you very much for that, Dr. Cragwell-Sims. Very well done. At this time, we'll go to the Virgin Islands Police Department for their testimony, and we'll begin with St. Thomas Hippolyte. Is here in St. Croix? Very well. We have the honor of having our Deputy Chief of Police, Houston Cornelius, in the chambers, and you recognize for your testimony on behalf of the Commission at this time, Deputy Chief.
Good afternoon, Chairman Novell E. Francis Jr. I'd like to echo the sentiments of Victor Soames III. As the families go through that situation, we just want to, say we sympathize with them. Good afternoon, Honorable Novell E. Francis Jr., Chairman of the Committee on Health, Hospital, and Human Services, committee members, members of the 34th Legislature, legislative staff, fellow testifiers, and to the listening and viewing audience. I am Houston Cornelius, your acting Deputy Chief of Police for the Virgin Islands Police Department, St. Croix District. Honorable Senator Novell E. Francis Jr., we would like to thank you for providing us this opportunity to testify on edibles and giving us the avenue to address the issues regarding same. Edibles has become a rising concern to the Virgin Islands Police Department, primarily with our children and the educational system. With me representing the Virgin Islands Police Department is Lieutenant Claudius Hippolyte from the St. Thomas District, who will be giving testimony on behalf of the Virgin Islands Police Department. I will be present as the lieutenant gives us the information and be on standby to assist in answering questions that might arise, if any, as it pertains to this issue. At this time, I will yield and have Lieutenant Claudius Hippolyte go ahead and give us the information.
You may proceed, Lieutenant Hippolyte.
Good morning, Honorable Novell E. Francis, Chairman of the Committee of Health, Hospital and Human Services, committee members and members of the 34th Legislature, legislative staff, fellow testifiers, and to the listening and viewing audience. I am Police Lieutenant Claudius Hippolyte, Commander of the School Security Bureau of the St. Thomas St. John District for the Virgin Islands Police Department. Thank you for providing VIPD the opportunity to testify on the matters of underage drug use in the territory, specifically the use of marijuana edibles. Marijuana or cannabis are food and beverage edibles are food and beverage that contains marijuana as an active component. Using several techniques, the marijuana flower can be infused in almost any type of food or drink. In general, marijuana edibles are produced to contain elevated levels of THC, the psychoactive compound that causes intoxication. In short, edibles are cannabis-infused food products that overextend and more intense effects to traditional smoking without the smoke and smell. Edibles can be consumed in various forms: baked goods, candies, chocolates, and beverages, just to name a few. Many can be purchased as ready-made edibles from dispensaries in the states and territories and have legalized recreational and municipal marijuana. There are also edibles categorized as make your own, such as oils, butters, ice cream, and the most popular, brownies. The list continues to expand as people continue to find creative ways to infuse marijuana into their favorite food and recipes. While cannabis edibles are popular among regular, long-term marijuana users, they are also a favored choice among beginners who are being introduced to marijuana for the very first time and are looking for the easy way to experience the effects. Edibles remove the smoke and the smell of the drug. As a result, teens believe they are masked in the marijuana use by consuming edibles. No smoke, no smell. Reduce the chance of getting caught. Therefore, marijuana edibles are becoming increasingly popular among teens. Since the start of the school year, the VIPD SROs, which is the school resource officers, and the Juvenile Bureau detectives has encountered several students who have consumed edibles on school grounds. Currently, we have 6 known cases of students who has overdosed due to edible consumption and possession in the territory. The severity of these issues are known, as it is believed some student illness went unreported by parents. Students have been found to have reported sick feelings, loss of consciousness, and feeling outside themselves. Overreaching danger of the edible consumption is the digestive time in the body. While the effects of smoking or vaping marijuana are often felt within seconds or minutes of inhaling, the effects of edibles are usually not noticeable until 30 to 90 minutes after they are consumed. Because of the delay effects, it is not uncommon for beginners to take second servings and then discover that they overdone it. Once digest and it enters the bloodstream, the marijuana faster a much longer high lasting, anywhere from 4 to 10 hours. Moreover, high potency can lead to serious side effects, such as paranoia, panic attacks, and hallucinations. The number of our students involved with or who have consumed edibles while on school premises is currently unknown. This, as known, has facilitated the development of the Edible Task Force. Our focus to combine efforts and resources to develop solution and a plan of action moving forward. The task force consists of personnel from the Virgin Islands Police Department, Department of Health, Department of Education, Department of Licensing and Consumer Affairs, just to name a few. We have also brought in our federal partners like the DEA of Puerto Rico, the Virgin Islands High Intensity Drug Task Force, which has assigned a newly appointed drug intelligence officer to the task force. Thus far, the task force has created public service announcements along with the Virgin Islands High Intensity Drug Trafficking Agency and their drug intelligence officer to educate the community. Open dialogue with our school regarding the dangers and effects of edible has been top priority. The task force has been productive thus far, and we continue to obtain knowledge and experience in tackling this fast escalating issue. We require the legislation assistance, however, in passing edible legislation. Presently, the Virgin Islands law allows the sale of hemp-based products which have a THC content of less than 0.03%. Any product containing that greater than 0.3% THC is considered legal based on scientific data. It gives users the feeling of being high. Our dilemma is the edibles we are encountering are all homemade. We lack the knowledge and ability to test THC in these homemade edibles. In order to enforce, we also require the legislature support through adding funding for equipment and training. The department suggests obtaining cannabis edible test kits, which test for the presumptive presence of cannabis in edibles, and a THC breathalyzer tool that we can detect THC in a person's breath. These are tools in the hands of our officers that can be used to test THC levels and confirm whether persons are under the influence of the drug. Funding would also support training for all territorial law enforcement officers. Senator Francis and members of the 38th Legislature, on behalf of the Police Commissioner Ray Martinez and the VIPD, I thank you for calling this meeting and providing us the opportunity to provide testimony on the edible issues today. This is a new threat that VIPD and our partners are fighting. We continue to acquaint and respond daily to these issues and look forward to all assistance this body can provide for us as we move forward to safeguarding our students. The Virgin Islands Police Department team and I are available to answer your questions.
Thank you very much.
Thank you.
Lieutenant Hippolyte. At this time, Madam Clerk, can you go ahead and read the testimony of Kazi Gomez into the record, please?
Good day, Honorable Senator Novell E. Francis Jr., Chair on the Health, Hospitals, and Human Services Committee. Honorable Senator Marvin A. Blyden, Vice Chair, members of the committee, and all other members of the 34th Legislature of the Virgin Islands of the United States, and the listening and viewing audience. Thank you for the invitation to provide testimony on drug use, specifically edibles, in the public schools and the territory. As a result of the DHS's Emergency Support Function 6, ESF6 Mass Care and Community Lifeline Responsibilities, the DHS Senior Leadership Team, who also serve as Emergency Services Coordinators, are actively presenting and engaging with the Federal Emergency Management Agency, Virgin Islands Territorial Emergency Management Agency, as well as other ESFFs in a week-long 2022 USVI Hurricane Season's capstone event. This capstone event is being hosted by FEMA and VITEMA and is held from May 23rd through the 26th, 2022, and will include a debrief to the Honorable Governor Albert Bryan Jr. and FEMA Region 2 Acting Deputy Administrator Jason Wind. Today specifically involves shelters and points of distributions, which are directly under the oversight of DHS. Thank you for understanding our physical absence. DHS understands the multi-layered negative effects of drug use by our youth, and specifically the importance of getting ahead of the trending use of edibles, especially in our schools. DHS is committed to contributing our expertise and services to this multidisciplinary effort. According to the American Addiction Center website, edibles are food products that have been infused with marijuana. These products come in a variety of different forms that can include baked goods, candies, gummies, chocolates, lozenges, or beverages. Edibles can be homemade or prepared commercially for dispensaries. When made at home, the THC, the psychoactive ingredient in marijuana, is usually extracted into oil or butter that can be used in cooking or spread directly on food. Although smoking remains the most prevalent method of marijuana consumption, the ingestion of edibles is quickly becoming a popular way to take the drug. Unfortunately, many people who consume edibles are unaware of the dangers associated with their use. The effects of marijuana edibles last much longer than smoking, usually up to several hours, depending on the amount of THC consumed, the amount and types of the last food eaten, and other drugs or alcohol used at the same time. The amount of THC is difficult to measure and is often unknown in many edibles. Regulations and quality assurance regarding the determination of THC content and product labeling are lacking, and as a result, the dosage estimation for many edibles is often inaccurate. Consequently, Many products contain significantly more THC than labeled, and people who consume these edibles can be caught off guard by their strength and long-lasting effects. The Department of Human Services, under the authority of 5 VIC subsection 2536, receives reports of child abuse, sexual abuse, or neglect. However, DHS receives reports of concerns regarding children in general, including children that are at risk for negative educational outcomes, as well as those at risk for becoming involved with the juvenile justice system. The department's Office of Intake and Emergency receives reports involving children, assesses and investigates the circumstances and transfers cases involving the behaviorally at-risk youth population to the Division of Intervention and Prevention Services for ongoing services. Youth who commit crimes that become involved with DHS become clients of DIPS without the intervention or assessment of the Office of Intake and Emergency Services. This division has a unit per district to provide traditional casework services and 2 residential facilities, the Youth Rehabilitation Center and the Anna's Hope Group Home. The intervention and prevention unit's clients remain in their homes and receive services such as individual, group, and family counseling, as well as other client-focused services from available providers. These clients are at times adjudicated as persons in need of supervision and are at times the subjects of consent decrees, probation, and court orders that govern their activities via strategies such as curfews. These youth are at times remanded to YRC. For FY 2021, 67% of youth remanded to YRC tested positive for alcohol or drug use. Much of those youth test positive for use of marijuana. Of youth admitted to the Anna's Hope Group Home, 10% tested positive for alcohol or drug use. Of the non-incarcerated at-risk clients who were screened, 22% tested positive for alcohol or drug use. While youth readily admit to marijuana use, there have been no disclosures of ingestion of edibles among this population. Clients who reported using marijuana are presently in the West Care, the Village Adolescents in Recovery, and Community Connections program, which is newly created. The village also conducts thorough substance abuse assessments when requested. Although no youth have disclosed or admitted to use of edibles, this division has a unit per district to provide traditional casework services and 2 residential facilities, the Youth Rehabilitation Center and the Anna's Hope Group Home. The intervention and prevention unit's clients remain in their homes and receive services such as individual, group, and family counseling. These clients are at times adjudicated as persons in need of supervision and are at times the subjects of consent decrees, probation, and court orders that govern their activities via strategies such as curfews. Through rendering our services daily and through pursuing and successfully securing additional federal funds and enhanced federal matches. Throughout the pandemic, the community's need for DHS's services have grown and are called upon to serve more people than ever. Chairman Francis, my esteemed colleagues from the Virgin Islands Departments of Education, Health, and Police have provided extensive information on the topic of today's committee hearing. The Department of Human Services is a committed partner with these agencies, as well as our nonprofit community, to assist with the success of our Virgin Islands children, youth, and families. DHS will actively participate in the multi-agency edibles task force to ensure best practices and prevention efforts, as well as intervention as needed with the clients we serve in our divisions. I ask the Virgin Islands community to genuinely appreciate the services and to take a moment to thank our human services team members for the dedicated frontline service to you, your children, your parents, and your family members. With the continued support of my executive branch colleagues, members of this legislative body, Governor Albert Bryan Jr. and Lieutenant Governor Tregenza Roach, DHS will continue to be committed to working together to make a difference for the people of the Virgin Islands. Thank you.
Thank you, Madam Clerk. Who will be testifying on behalf of Commissioner Justa Encarnacion for the update on COVID-19 for the territory? You may proceed with your testimony.
Good evening, Senator.
Please proceed and put your name on record.
I am Acting Commissioner Dr. Nicole Cragwell-Sims, Assistant Commissioner, Department of Health, providing testimony on behalf of Commissioner Justa Encarnacion, who is currently out of the territory attending an ASTO event on the management of COVID-19. COVID update. As of today, we had conducted a total of 417,772 tests. 19,252 of those tests have been positive throughout the outbreak. There are currently 947 active cases within the territory, and our 7-day positivity rate stands at 12.6%. We continue to offer daily COVID testing at drive-through testing sites on St. Thomas and St. Croix, and once a week on St. John. Regarding vaccinations, territory-wide, 57,012 individuals are fully vaccinated with a rate of approximately 54.5%. The vaccination rate on St. Croix stands at 44%, on St. Thomas, 47%, and on St. John, 74%. The United States Virgin Islands is one of the very few jurisdictions that have maintained their community vaccination centers. The CVCs are open daily on St. Thomas at the Community Health Clinic on St. Thomas, the Community Health Clinic on St. Croix in Building 1 of the Department of Health Modular. Vaccines are also provided weekly on the St. John at the Port Authority gravel lot. Under the leadership of Dr. Tyhon Caesar, we have instituted the Test to Treat program here in the Virgin Islands. It is a nationwide initiative launched by the Biden-Harris administration, which gives individuals an important way to quickly access free, life-saving antiviral treatment for COVID-19. The department has also ensured the availability of monoclonal antibodies. The pandemic continues as we attempt to enter the endemic phase. Endemicity is defined as a state in which a disease is persistently present in varying concentrations. A virus like COVID-19 will always be circulating among us in some form, much like the flu or the common cold. Thus, some portion of the population will always be positive for infection, whether they know it or not. Right now, while our numbers are high, transmission is likely. Senators, it is our ask of you and our community members to become part of the territory-wide solution by doing everything to keep yourselves and those around you safe and healthy by getting vaccinated and boosted, wearing a mask, socially distancing, practicing frequent hand washing, and staying home when sick. Do not be ashamed to wear your mask as part of your daily routine. We should all evaluate our own situation and reduce our risk factors. The decisions you make about your environment are equally important as those you make about becoming vaccinated, and vaccines are still available, so is testing. As we continue the road to endemicity, last week the department shared with you our decision to align our precautionary recommendations for isolation and quarantine with CDC recommendations. These recommendations include: if I'm COVID-19 positive, If found COVID-19 positive by a viral test, you must isolate despite your vaccination status. Further, everyone with a positive test result is to isolate for at least 5 full days and remain isolated until you are fully better and no longer with symptoms. If you have been fever-free for 24 hours without the use of fever-reducing medications, you may end isolation after at least 5 days. Take precautions for a complete 10 days and wear a mask during the entire 10 days, especially if you're around someone who is immunocompromised. You do not have to repeat a test after ending isolation. Quarantining is for anyone exposed to a positive COVID-19 case, and there are 3 distinct categories. 1, if you are not up to date with COVID-19 vaccines, you should quarantine for 5 days, wear a mask at home around others, watch for symptoms for 10 days, wear a mask for the entire 10 days, regardless of the presence of symptoms. Everyone in this group should get tested on day 5 from the exposure, even if symptoms do not develop. 2, if you're up to date on COVID-19 vaccines, meaning that you have been vaccinated and boosted where eligible, no quarantine is needed unless symptoms exist. Everyone in this group should get tested on day 5 from the exposure, even if symptoms do not develop. A well-fitting mask should be worn for 10 days from exposure. And 3, if you had a confirmed case of COVID-19 within the last 90 days, no quarantine is needed unless symptoms develop. Watch for symptoms until day 10 and wear a well-fitted mask for the entire 10-day period. As always, we wish to thank the Virgin Islands Department of Health family for all that you've done and continue to do. In conclusion, Senator Blyden, the Department of Health continues to fulfill its tenet of our vision to reduce health risk, increase access to health care, and enforce health standards. We're dedicated to reducing health disparities and increasing health equity, not when discussing the reduction of the use of edibles, other drug uses, or COVID-19, but at all threats to our health care. The department commits and continues to collaborate with the efforts of the members of the 34th Legislature. Senators, this concludes the second portion of our testimony. Thank you for your support of our efforts as we continue to build a healthier Virgin Islands. I welcome the opportunity to respond to any questions.
Thank you very much, Dr. Sims, for your testimony there. And before we open the floor for questioning, is there anyone else on the line to testify today, this evening? Very well. Thank you. There's someone that have the mic on at this time. So, Dr. Sims, in regards to the gift cards, a question that was presented to my office, what is the status on the $250 gift card? I heard that the last round of gift cards had ran out, and they had promised that within 2 to 3 weeks, certainly those gift cards would be available.
Yes, sir. Dr. Nicole Sims, Assistant Commissioner, Department of Health. That is in fact true. Once we opened the initiative to coincide with given vaccinations, the anticipated number of gift cards did run out. So what we have been doing is taking name and numbers at our large events, Carnival, upcoming events in the territory to produce those gift cards. Our latest status shows that those cards have been ordered. We usually order them on an assumption, an approximate number, and so we're waiting for that confirmation that the cards are in the territory, sir, and they will be distributed at that time.
Okay, very well. And I guess the public would be advised when they're available at that point.
Yes, sir.
Okay. So I want to thank everyone for their testimony in regards to the edibles. And of course, outside of edibles, we still have the issue of opioids, fentanyl in our community that also presents some challenges. So we have to be continuously mindful of that. At this time, I'd like to open up the floor to a 5-minute round. And if you need some additional time, just let me know. Senator Blyden, you're recognized for your 5 minutes.
Thank you, Mr. Chair, and good afternoon again to the testifiers, and thank you so much for your testimonies. Assistant Commissioner Sims, I want to thank you for the PSA. Very good message that you have on the airwaves. In respect to today's topic, edibles within the schools, I just want to have some clarity in terms of the data, because for the Department of Education, the chart on page 4 that stated CHS had 1 student that was transmitted to the hospital, 2 at Ivani Doraken, 3 at C Central High, and 4 on St. Croix, 3 on St. Thomas. And also in the testimony, I believe from Commissioner Encarnacion, he spoke to, I believe the number was 18, or same, Dr. Sim, 18 individuals. And also the report from the village, he spoke to a percentage, I believe 60 plus percentage had alcohol and drugs. But I would like to know, in respect to drugs and alcohol, I'm happy to see that we formed a task force in order to get in front of the issue. But at the same time, alcohol is the easiest for any and all of us to get around here, but we have not seen anything in that respect. And I would like to see the numbers in all of those different research and inquiries when it comes to alcohol within the schools and outside of the schools, because I think that's a big part of what's going on also. And also with the data, I would like to see exactly what happened with those individuals in terms of what some of those mistakes, whereas they ate a brownie by mistake, someone gave them a brownie, or whereas they took it with something else. I would like to see that collective data to really dive in to see exactly what's going on and how we can correct it. But nonetheless, it's a start. So I applaud you guys for that. So let me ask, in respect to edibles, have you, from the task force perspective, have you seen, say for instance, compared to say 2 to 5 years ago, what type of increase have we seen in respect to edibles within the school system? I'll start with the police department, and I'll start with go to the Department of Health. If you may, please state your name before you speak.
Houston Cornelius, Deputy Chief of Police, St. Croix District. I will yield to Lieutenant Hippolyte.
Very well. Lieutenant Hippolyte?
Well, it has increased, and it started to increase really for us when we noticed these cases is in April month. Within about 3 weeks, we could say all these cases pretty much came in at the same time.
Wow. Within 3 weeks, you said, after within the carnival season?
If you calculate the dates in which the incident happened between St. Thomas and with St. John and St. Croix, they're about almost the same time, within the same period. They're not too far apart from each other.
Okay, thank you.
But we have to pay in mind that we just started school this year, because before everybody was doing online school.
Understood. So you basically, based on what was said in testimony, they had a lot of time on their hands while they were at home. So apparently the communication and etc. assisted with that number going up, you think?
I do believe so, but I don't have any data to say so.
Okay, very well. Assistant Commissioner Sims?
Thank you, sir. We actually did reach out to the hospitals and were able to get a few numbers relative to the data. And in 2020 at Schneider Regional Medical Center, cannabis abuse and dependency was about 36. In 2001, it was 46. And this year so far, it's been 18. So it's tracking down, but that's this number thus far. And at Juanif Louis, between May of 2019 and April 2020, they reported 3 cases. And as mentioned in the testimony, between May 2020 and April 2021, they're at 14. And so we're continuing to request for them to be able to pull that data so we can compare the data to whatever the Department of Education is able to come up with. But those are the numbers we have thus far, sir.
Okay, thank you for that. And when it comes to our young people, again, and I stress this because I believe alcohol is on the rise also. And I think we need to also form a task force when it comes to that most dreaded addiction. It affects many families in so many ways. We have been hearing for years about the problems with alcohol, heroin, opioids, and all them other related drugs. And do we have any evidence within the school population in respect to those other type of drugs? Anyone?
Good afternoon, Senator Blyden. Victor Sum III, Assistant Commissioner of Education. The department collects data and then inputs that data in our student information system known as Power School. Keep in mind that students were out of school for a year and a half, almost 2 years. So when we compare, we have to go back to the 2017, 2018. So the data is kind of disjointed because of the storm and then
30
out for
seconds.
COVID. What we suspect is that there are greater numbers of edible use. They just haven't been reported because the effects or the impacts of that use hasn't manifested in school. It may have been on the weekend, it could have been after school, but we haven't seen, other than the numbers reported, we haven't seen those in school, even though we suspect that the numbers in terms of the use are higher.
Okay, and in closing, Assistant Commissioner Sims, in respect to the data that you have received, the age of those individuals, what percent have been like 18, 13 and under, or 11 and under? What's the age rate based on what you have seen based on the data thus far?
Yeah, so this data that we got from the hospitals actually are just under 21. It's very broad. So we would have to kind of dive in to get a little more specific on the age range for you, Senator.
Okay, thank you so much for your responses. Thank you, Mr. Chair, for the time.
Thank you very much, Senator Blyden. Lieutenant Hippolyte, in regards to the edibles, how are you treating those cases that have been reported or when you come in contact? I know that in your testimony you mentioned about the lack of adequate testing to be able to analyze the edible. How are you treating those? Are you utilizing the Duquesnoy field testing to make that determination, or what gauge are you utilizing to make that determination of whether or not edible is potent or it do have THC levels contained within it?
Well, when it comes to the information you're requesting, the VIPD get aware of it usually when they go to the hospital, because then it becomes, they have to call us. And when we go in there, we do investigation, then we kind of find out the people who was involved. But pay in mind, we're dealing with juveniles, so we have to stay within the context of the law, reference to questioning them or ask them who all is involved. And that's when it got a little tricky. In terms of testing, we don't have nothing to test the edibles because most of the time when they reach the hospital, they already ate everything.
Very well. And do you have you done your research to determine what that test, the cost of that test, or what would be required for the police department to be able to conduct the testing or the assessment?
I don't have it with me at the moment.
Okay. If you could get that to us, yeah, we could work and provide some resources to assist in that endeavor. All right. Next, we'll recognize Senator Viola. You're recognized for your 5 minutes.
Thank you, Mr. Chair. Mr. Sum, have the Department of Education held a meeting with school administrators to find out exactly the severity of the issue?
No, we haven't done that as yet, sir. That is something we want to do and provide, not only meet with them, but also provide training.
Okay, so hold up. So we form a task force and we have not met with the school administrators to find out the severity of the problem, of the issue?
Well, we have definitely spoken to them individually. The districts have, and we've gotten input from them. We haven't met with them collectively, sir.
Have school administrators reached out to the Department of Education that they are having a serious issue with marijuana edibles?
Dr. Brown or Acting Superintendent Atlee Herman?
Good afternoon, Senator. In the St. Croix District, we met with their two high schools that had the edible issue, St. Croix Central and Educational Complex. What we've also schools have reached out.
What was the feedback from those two? Superintendent Atlee, what was the feedback from those two schools? They're having a serious issue?
So one school, not so much. The other school, there was more so of an issue, and it was heightened at the time. What we saw was the onset of edibles as a major issue. We also saw vaping, which is the use of marijuana oils. And then we saw straight marijuana products at both schools. And straight marijuana.
Junior high and elementary?
So in our K-8 schools and junior high school, we saw vaping as an issue. We had about 1 or 2 incidents, I would say, across the district with vaping. Elementary, no incident to report it.
St. Thomas?
We have more of the edibles eating. We don't have the vaping in our school, and it's mostly the high school at the moment right now.
So the administrators for both high schools have made a complaint about marijuana edibles?
No. Good afternoon. I'm Dr. Simradi Brown, and because there was 1 incident at one high school, 2 incidents at the other, I guess it did not appear to the principals as a severe issue, but we have reported to the authorities that we did have these concerns. And 1 student is enough for us.
Interesting. I have spoken to or had conversation with teachers from junior high school, along with high schools, who are complaining about students coming to the classroom after lunch soon. I can name the schools in St. Croix that have received a number of complaints. What bothers me is that this is actually an industry in the high schools. They're selling marijuana edibles. There are individuals who go to school on a regular basis and sell marijuana edibles. And individuals know who those sellers are. So we have a number of issues here. One, we have this increased drug use of the underage population, and the edible is actually getting them even higher than smoking. And then we have the fact that these edibles are produced in somebody's house. It's baked in somebody's oven. So there's some type of approval there in preparing this product, mixing it, making sure you have the marijuana in it, baking it, and then allowing it to cool, and then packaging and going to school the next day. This is a serious issue.
2 minutes.
And if you speak to the ground forces in the school, a lot of students are high after lunch, quite a bit, too much. And we have to address it. Does this fall under zero tolerance? Exactly what does it fall under? What are we going to do in reference to disciplinary methods? Are the schools having grade level assemblies that explaining to students that selling marijuana edibles is illegal? I mean, what type of information are we relaying to the students? Are we sending home or letting parents know that if your child comes to school with marijuana edibles, is an automatic suspension? Okay, it has to be dealt with seriously. Because I've known students in school, they have been reported on that have become severely ill, throwing up on the ground in pain. I don't want us to brush this aside, This is a very serious issue. And you need to have a conversation not only with the administrators, you need to have a conversation with some of the staff in reference to the effect that it's having on the school-based population. And all the studies we have read, I mean, casual use of marijuana is accepted in a lot of places, that's fine. But after a certain age, because it kills brain cells. So you don't want them to start smoking at 14 years old, at 13 years old. They're 25, that's the problem. So we don't want that underage consumption of marijuana edibles to be taking place in our schools. And the task force is fine, but we need to aggressively at the beginning of the school year. They need to know what the rules and regs are. And monitors need to know how to check. While somebody walking in with a tray and it's fine. You got to know exactly what you're checking for so that we could be able to reduce the number of underage students who are partaking in selling, buying, and using. Thank you, Mr. Chair.
Thank you very much, Senator VLA. I wanted, which entity will then be responsible for, I mean, I know that Department of Education here speaks to the public schools, but outside of that, who then address the private and parochial schools? Department of Health? Is there a collaboration by the task force or Department of Education, Virgin Islands Police Department? Who brings the information or at least do the awareness for our private and parochial schools as well? VIPD, we'll ask you first.
Houston Cornelius, Deputy Chief, St. Croix District. As it pertains to information handing out or giving out, our, I don't want to say weed and seed, but our division that deals with the children, the weed and seed officers, they would go out and disseminate the information and try to make them aware of what we have in front of us.
Okay. Because I would imagine this is not just happening in all public schools.
No, it isn't.
Okay.
Now, in terms of the kit that you heard Lieutenant Claudius Hippolyte spoke about, the Virgin Islands Police Department has already looked into it, and an order is on its way. It's placed. So we're looking forward to getting those test kits in so we could try to, address that. Let me just say this, Chairman Francis. In terms of this whole issue, our school resource officers, and I want to make sure I say it just plain so our elders could, when we say school resource officers, those officers that work in the schools. I learned about this issue when we were talking to our commanders call. The commander, Dennis Vanterpool, brought this concern about students that were high, that were just going off. Some of them couldn't walk. And that's how I started to become knowledgeable of it. A school resource officer by the name of Osborne, and I call in the name because these guys are the ones that has first-hand knowledge and making contact with these students.
Yeah.
Osborne ran into 2 or 3 cases where the students had to be taken to the hospital.
Because he's in the school, so yeah, he's exposed to it. Yes,
right. And they can't walk. They're very, very loud. Some of them, they have breathing problems. And he became, I don't want to use the word angry, but he was very, very passionate about what he was seeing with the students. So when he brought the issue to me, I was like, what are you talking about? You for real? And he said, hey, Chief, this is what's happening in the schools, and we need to do something. So with Captain Vanterpool and Osborne, I then said, you know something, I need to go to the airways because our parents probably are not aware of what's going on. So when I came up with that, the commander said, you know what, I think what we need to do is touch bases with the school. Don't go to the airways. So we started this, and right now we're here trying to get help because I don't want our children to be dealing with this situation much more longer.
Very well.
So we're here begging for help. Let me see how we could walk this thing and keep our students safe. Keep the education platform, the grounds safe. These are the future.
Very well.
Senator Francis, if I may.
Acting Superintendent, I'm sorry, Mr. Assistant Commissioner, you're saying?
Yes, just a couple of things to re-emphasize what I had said earlier. We are working with the Department of Health over the course of this summer to train monitors, to train individuals on our campuses to recognize the signs and symptoms of edibles use. I want to re-emphasize the fact that we have had a significant campaign, social media campaign, to share information that this is a crisis, providing tips to parents on what they have done. So I want the message to be that we are taking this seriously, that we are speaking to our administrators, that we are speaking to our teachers, perhaps not collectively, but certainly individually as the reports come in. And then I know that Acting Superintendent Herman had wanted to add to that.
Yeah. Go ahead, Atlee Herman.
I wanted to just address the fact that we met with our school teams, but not just that we meet with our school teams. We supported their plan of action. We held assemblies and they held assemblies. Central High School, which had the higher number of cases, held an in-person PTA where they brought their parents in to explain and speak to them about the consumption. What are they seeing on campus? In one of the situations or the cases that's referenced, we were able to identify the students who consumed it and the individual who brought it on campus, and that person received their disciplinary action as outlined within the Virgin Islands Board of Education policy. In one school, we had an individual, a student who collapsed. So we heard, of course, school children talk. And so the reports were made that this child may have consumed something at our other campus. When we spoke to the school, the parent took the child, the parent reported the child was dehydrated. So we do our due diligence, we research, we educate. We've contacted through our fellow agencies to make sure, but we know the impact of edibles and we've tried to get ahead of it, which I have to say, after we started with the task force and the campaign, the number of instances and cases of edibles have reduced. We're working also to look at vaping. We're looking at the opioids. So this is not something new. Our children sat home for 2 years, and Dr. Sims post, they became chemists and they became vapors. They have access. So in our community campaign, we were trying to make it clear where parents and community stakeholders, we need you to be aware of the fact that our children have access to this, and we would like you to limit the access that they have to it. So we have been pushing and will continue to push. In the summer, we're actively engaging and ramping up. So at the start of the school year, we put interventions in place and education in place.
You appear to be frozen at this time. Are we also, are you back? Ms. Atlee, are we also engaging our PTAs and those other organizations to make sure that the information is getting down and out?
Yes, we're going to engage our PTAs. We're going to continue with our community workshops. We want to make sure it gets out. And if teachers are aware of something, they should report it to the principal. If a student is aware, they should report it to the principal. We've had to engage the counselors at schools. Central High School, the counselors opened up and conducted sessions with classmates who saw the young lady collapse to educate them and talk about, what happened and what are the effects and if she's going to be okay. So we've been looking not only at the effects on the student who consumes the edible, but we've been looking at the effects of the students who have to observe what happens.
Okay. Yeah, I think we're just seeing the tip of the iceberg here, and there's a lot more cases that we need to focus in on. Senator Blighty, you have a point of inquiry? You're recognized for a point of inquiry.
Thank you, Mr. Chair. Assistant Commissioner, I heard you again refer to it, refer to edibles as a crisis. Again, the elephant in the room. The elephant in the room is alcohol. It's more easily accessible because every house in the Virgin have alcohol, readily available for any child or teenager to get to. So honestly, it is a crisis, but we need to understand and be real when it comes to issues in the territory, and that's the elephant in the room, and we need to address that also. So I would like to see something moving forward in that respect when it comes to other drugs. Thank you, Mr. Chair, for the time.
Alcohol is a problem.
Excuse me, Mr. Chair.
Today's conversation is about edibles. I will admit that, yes, alcohol is a problem in the home as well, but today's conversation is about edibles. At this time, Senator Sorrow, you're recognized for your 5 minutes.
Mr. Chair, the testifier, Sergeant, Lieutenant Hippolyte had
I have the answer for the information you requested.
You may proceed, Lieutenant Hippolyte.
For the mobile detectors, is about $1,200 for one. And in reference to the testing, the portable ones, them is about $100 for one, and we ordered about 300.
Very well, noted. Senator Sauer, you recognize for your 5 minutes.
Thank you, Mr. Chair. Dr. Sims and I used to teach together at CHS. We shared a classroom, as a matter of fact, US history and VI history. And I had a third period, the max in a classroom is 27 students, or 27 students. And I would have about 19 IEPs for 27 students. My third period, I remember distinctly, one of them. And that would be my third period, that would be high after lunch. And in doing research, most of them that had ADHD or other learning disabilities, they turned to cannabis as a way to cope. So the question would be, I think I would be asking this for those in the 504 program, what are those discussions that we're having with those pairings for that group? Not all of them, but a lot of them utilize or engage in cannabis use to cope and calm them down. So are we having discussions with those students in the 504 program on potential abuse of cannabis underage use? Who would I be speaking to on education's end?
Good afternoon, Senator Sorrell. Yes, we are having those discussions with our special populations. We see the impact. A lot of the discussions.
Hold on a second. You say you are having these discussions. Did you have them prior to school ending?
We've always had those discussions, Senator. That is nothing new in the department. We have those discussions in classes. We have those discussions as a part of IEP meetings. We have those discussions when our students become adjudicated and DHS is involved. So it's been ongoing. And those discussions are had because we see how illegal substance abuse affects the students' performance. So those discussions are routine. They're a necessary part of the discussion when we suspect a student is a substance abuser. A lot of the discussion.
Hold a second.
Mm-hmm.
Hold a second. Let me jump to, because my time is going to be called in a few. Dr. Sims, I know you have radio ads out there. Truth be told, my niece, she's 16 years old. She ain't turned the radio on for the last maybe 4 or 5 years. Any thoughts of meeting them where they are, like on TikTok, Snap, YouTube? Any thoughts of that for the messaging campaign?
Thank you for the question, Assistant Commissioner Dr. Sim, Department of Health. Yes, absolutely. I think part of we try to cover everything that touches your eyes, ears, okay? Because it's important. One of the things that we discovered in the task force is that a lot of parents didn't even know what an edible was. And in a lot of those meetings and reports that we got, and I know this is going on the record, but people thought it was underwear. And so we needed to hit everywhere. So those things are coming when we meet them where they are, but we do still need to use the radio because a lot of the parents or grandparents who are now the caretakers listen to that. And we're hoping that some of those words are triggers for them to receive the information, and it will dovetail into where, students are, Snap, TikTok, and all of those different platforms, definitely.
Perfect. And the last point I want to make is we have an enforcement deficiency period. And I know today's topic is edibles, but we have an enforcement deficiency. You could go we have the Office of Cannabis Regulation has yet to promulgate rules and regs, but we have an underground market selling you edibles and anything cannabis related openly. We have dispensaries right now that are open, selling you edibles without asking you for identification. We had carnival, we have students walking around the village with a cup of alcohol in their hand openly. So until our enforcement agencies send a strong message that I will shut you down for doing, we selling lottery tickets, illegal lottery tickets. When you go in a corner store, it's on the counter. There is absolutely no fear of our enforcement agencies. So it's kind of like chasing the tail.
for lack of a better word. So we're talking about edibles now. Let's look at Garden Street. You have students going to All Saints every single day, walking through young men whose job is to sit there and sell hard drugs and marijuana. And then we pass a whole loitering law, and every single day the Lord send the people sit on the bottom of Garden Street, and students walk through that every day. You don't think at some point one of those dealers can get to a student? When we were at Amalia High School, Dr. Sims, you know, we had shakedowns. Do shakedowns still happen? And when a shakedown happen, I promise you the campus have peace for maybe the next 2-3 months till the next shakedown. You see them scattering. And that's when you find who is selling weed on the campus, who have edibles in the bag, and education sends a strong message of a zero tolerance policy on campus. Are we doing shakedowns? Where's our enforcement? We have to instill a fear of God in some of these people. Are we doing shakedowns still, Mr. Sum? We call them a shakedown. I don't know what's the correct term.
That is the correct term. Searches. I'll let the district respond because they're dealing with these things on a day-to-day basis.
Dr. Sims, I mean, not Dr. Sims. I try and say Miss Dr.
Dr. Brown.
Brown, but I call you Sims. But you know your first name begins with Sims, Simra. Okay, Dr. Brown, go ahead.
Hi, good afternoon. I don't want to state that it's a learning curve for what you just spoke about. So what you just spoke about, we do have individuals that are on our campuses, and we are very much aware. And so with a lack of the police enforcement and the lack of individuals that can shake down, it's very difficult. So I do agree with you in that. But I want you to know that with these new edibles and this on the campus, it's definitely a learning curve for us. We cannot just walk up to a student anymore and know that you just ate a brownie. Until you had the brownie and 90 minutes later, it has an impact on you in the restroom or wherever you pass out, that's when we know. So we also need to learn how to identify these things. And I am going to say it's for me a big deal, because it breaks my heart when I hear of students passing out, falling out. And when they come to our meetings and they tell you straight up, I didn't know what it was going to do to me. I don't know why I took it. Someone told me it tastes good and I'm going to feel good, and that's why I took it. It's one of the most amazing things. So I am in the mode of learning about this whole thing. Thank you.
Okay, Dr. Ms.
Excuse me, I would like to make a statement in reference to your to the comment.
My comment?
Yes.
Okay, hold on.
Okay.
I don't know how much time I have, but I'd like to hear the superintendent, and then you, Mr. Hippolyte. Go ahead, Ms. Arzala.
Good afternoon, Senator. Yes, we don't call them shakedowns. We call them random searches and lockdowns. So we would.
Please identify yourself. Ms. Ackley, please identify yourself.
And so we've done that at both high schools. We searched bags. We've even done searches at the junior high level as well. So yes, we did have done them. I believe in all 3 searches at Johnny Schultz, when we did a lockdown, we yielded some marijuana paraphernalia. We yielded weed at the educational complex. I believe when we did the lockdown there, and at the Central High School, we also yielded paraphernalia. So we do use our monitors. We lock down, everyone stays in place. They go around, they search bags, and they pat down the person just to see what you may have in your pockets as well. Remove your jackets, and we collect and deal with the students.
Okay. Lieutenant?
Well, with VIPD, we're a little different because we have to abide by the law. We have had traffic stops for the students who actually go to the school this year in reference to the same paraphernalia. We also have been performing operation in reference to the sale of drugs in the area of the school since the new year has started. However, I cannot comment any more about reference to what has happened. Okay?
Thank you. And Mr. Chair, has my time been called?
Yeah, about 5 minutes ago, but go ahead with your wrap up.
Oh, I'm sorry, but we just need to strengthen the enforcement arm of the government, period. We need to start IDing and letting people know that, you know, you go down French Town right now, you can walk in and buy edibles and they're not going to ask you what's for your ID, you know. So some of the stuff that we could do, let's control that. Mr. Chair, thank you for the latitude. I appreciate it.
Thank you. Thank you very much. Senator Viola, you had a point of information, inquiry?
Point of information, yeah. I just wanted to say that officers are not allowed to do searches in school. They can stand and assist and stand by, but they can't actually go and search the students. That is done by the school staff and the monitors. And I think that because we're having this issue, we just need to increase the frequency in which we do random searches and the frequency in which when they're coming into the school, you have everybody open a bag. Open your bag, let me look inside. I mean, there are different ways that you can really begin to enforce certain rules that would make the students be a bit scared to walk in with something that they know is illegal. Thank you so much, Mr. Chair.
Thank you very much, Senator Viola. That's a very good point. Testifiers, please, but as we have a change of the stenographer, so when you first begin to speak, at least identify yourself. Senator Carrion, you're recognized for your 5 minutes.
Well, thank you, Mr. Chair, and good evening to testifiers and my colleagues. I think this is a very important committee hearing, so I thank the chair for bringing this topic forward. Now, I realize that I believe in about two of the testimonies that were presented today, I heard and read the word crisis. So are we really having a edible crisis? And I say, I'm asking the question because when we are asking for data and statistics, the numbers are not there. So who can help me out?
Good evening, Senator Carrion. This is Victor Sum III, Assistant Commissioner of Education. I think Dr. Brown said it best. One is too much. One student caught possessing, selling, eating an edible, drinking alcohol, using a vaporizer, one is too much. And if that is the logic, then indeed we have a crisis. No, I want to reiterate that what is important is that everyone understand the data is based on what is reported. And so despite the fact that the reports, the numbers seem low, our suspicion is that there is more in terms of edible use. It's just not being reported because staff and students aren't seeing the effects of the use of edibles until after school, it may be on the weekend. But we strongly suspect, as Senator Viola indicated, teachers are reporting that, at least to him, that students are coming into school high.
And that's
what should happen is that those teachers need to report it to their administrator.
Assistant Commissioner, and I think that's where I want to really reach and draw on the point that we need to report. So you have the administrators and teachers and counselors. We need to start documenting things, and we do a very poor job here in the Virgin Islands when it comes to data and statistics. So we really need to improve in that area so that we can really measure where we are. So are we having assemblies in the schools? Are we taking surveys from the students to really find out, you know, what are they indulging into? And what those numbers look like, so that when we speak, then we're speaking with data and information, and we're data driven. I must agree with a colleague that spoke earlier about enforcement and how important that is, because if we are really having a crisis, then we need to act as though we are, and we need to vamp up the marketing, the messaging, the education portion, and really step up to ensure that we protect our children and protect the students. You know, my good colleague from St. Thomas, Millennial, the good Millennial was saying about you can walk down to a store in Frenchtown and you could go to a gas station and they're not behind the counters. You could reach edibles are colorful anywhere and you could just grab it, and it's just like any regular candy. So if we're really serious, then we need to put action to what we're saying. And I'm not belittling what the different departments are doing. So I commend Dr. Sims and her department for the messaging that is going out and the efforts that other agencies are doing, the Department of Education and the police department. But I believe we need to do more so that we really don't fall into a crisis where our numbers are really crazy and out the box. So that's just my piece that I wanted to share now. Lieutenant Cornelius, correct? Deputy?
No.
Deputy Chief.
Claudius is the lieutenant in St. Thomas.
Oh, okay. Well, my question is, when it comes now to penalties and to the law, how are we handling situations with distribution of edibles to minors and distribution of edibles in schools? Do we have any information? Any charges have been brought forth in that regard?
Lieutenant Hippolyte from Virginia Police Department School Security Bureau. We do have information because whenever the situation happens, a report is generated.
30
However,
seconds.
because they're minors, we cannot release the names and some of the information is prohibited to certain people. But we are investigating the matter and we're pushing forward. That's what I can tell you.
Okay. Yeah, we understand you can't provide names of individuals, but you could tell us numbers and you know, oh, you know, you're investigating 3, you have arrested, you've done this, there are penalties that are in place. So that type of information. Do you have any
The 2
data in that
cases
area?
in St. Thomas that we're dealing with, we are investigating the matter still. And reports was written, names was called, and we're doing an investigation in reference to the matter. That's as much as I can give you.
All right. Well, thank you, Mr. Chair, once again for bringing this forward. It's my hope that members in our community are listening, parents, and everyone in the community, because it takes a village. So we really want to turn things around. We all have to do our part to make the difference. Thank you, Mr. Chair.
Thank you. I think the question that you were asking is what's the penalty for the sale of edibles, and if anyone is caught, it's just the penalty is the same for an adult as it is for a minor in terms of because it's illegal, right? It's illegal to sell edibles as long as they have that THC levels in it. I mean, there's a controlled substance. It's currently illegal, and the same applies to both entities. Whoever is selling it, they're also in violation of the law. Senator Saru, you recognized for your point of information.
Thank you, Mr. Chair. Just wanted to also add to it too, collaboration with DLC as well. When you walk into a lot of gas stations or corner stores, you are going to see a Rice Krispie in a homemade Ziploc bag on the counter, a bunch of them. And Rice Krispie treats come from Kellogg's in the blue bag. And you see the Rice Krispies and the brownies just glaring on the counter. So I don't know if the students actually home making a brownie or a Rice Krispie. You could buy it in the corner store when you're buying a soda. And that comes with collaboration with DLCA, and it's just so blatant, you know. So the enforcement deficiency, it really bothers me that it is easy to access an edible. So we having a whole PSA in health and in the Department of Health and Education, but we really could make a dent by cracking down on those gas stations and corner stores that are so blatant in selling edibles when you checking out. Thank you for the time, Mr. Chair.
If I could, Mr. Chair.
Go ahead, Assistant Commissioner.
Thank you, Mr. Chairman, Senator Soro. Victor Sum, the third Assistant Commissioner of Education. DCLA is a part of the task force, and I clearly do not intend to speak for them. I think Commissioner Evangelista is quite capable of doing so, but he has commented as a part of the task force that they are going out to establishments, particularly those that are selling hemp products, selling CBD products, and reminding them that it is illegal to sell to underage individuals. We will bring that up again in our next discussion with the task force and share with you the response of DCLA in terms of those little corner stores, those little mom and pop stores, those gas stations that just openly have these things available for anyone without checking age.
Thank you for that. At this time, we'll go to Senator Francis Heiliger. I know you're chopping at the bits. You want still a discussion on this. So, Senator Heiliger, you're recognized for your 5 minutes at this time.
Thank you so much, Mr. Chair. Good afternoon again to my colleagues, testifiers, staff, people of the territory. I've sat here and I've listened to quite a bit of the responses, and I'm going to be honest, I really feel for the children of this territory. I mean, between the drugs, the sexual predators, the bullying, and just trying to get quality education, these children seem like they're up a creek. I don't know what is happening here. And simple things like data, simple things like information, so that when you come to this body, that we would be able to know what we have to do to help you, to help them. A lot of that is lacking. I'm very concerned because, you know, even listening to some of the testifiers, now, as an individual that have attended quite a bit of IEP meetings for years, not a single time, Mr. Som, not once in any documentation I've read that has been handed to me, that has been turned over to me, that any of the individuals in the room that I have ever spoken to had a conversation with me correlating marijuana use and IEP students. But when you sit here and tell the public and myself that this is a regular part of the discussion, I am telling you point blank, that is 100% false. That is not happening. So I don't know if you have to go back to the drawing board, because my colleague brought a correlation between the two, and it might have been easier for you to just say that this is happening. But I am telling you as an individual that have gone to quite a bit of these meetings, not once has that discussion come up. So you need to go back to the drawing board with that.
If I may, Senator?
No, you may not. Thank you. As it relates to understanding a little bit more, how do you guys intend on bringing parents involved? I understand how you're going to market to them, to give them or let them know things are happening. But after the fact, how do you intend to make them a part of the resolution and the solution to help these children?
Good afternoon again. Victor Sum III, Assistant Commissioner. Senator, before I get to your question, I must say that your previous statement,
Mr. Sum, I specifically told you cannot utilize
Senator, it is unfair for you to make that statement and not allow me the opportunity to respond.
If you would like to utilize your time to respond
Assistant
to that,
Commissioner, is the Senator's time?
But
Hold
I
the Senator time. Senator Francis Heiliger, let me handle this, please. Assistant Commissioner Soms is the Senator's time. She asks what questions she want to be answered, and her time, I'll allow you to respond, and my time if you need to respond to a concern.
Thank you, Mr. Chair. In response to the Senator's question, the department, along with the task force, will conduct parent meetings beginning next school year. We will conduct presentations for parents that speaks to illegal substance use to include edibles.
Are these programs currently developed already in preparation for the next couple months, because next year is rolling around soon, or are we planning to prepare them? What is the planning process right now?
The planning process is going on at this time, ma'am.
Okay. I would like to know specifically, when we spoke earlier about the search and trying to get a handle on understanding how these drugs are getting in and what could potentially happen to stop them. What happens when children are caught with these drugs? What happens when you identify that you found maybe one or two are the sellers? What happens to these children? Has anyone been able to catch any of them red-handed?
Yes, we have been able to. I'll have the districts, because they deal with it directly. Acting Superintendent at the Herman, and Deputy Superintendent Brown, if you could respond, please.
Thank you.
Sure. Good afternoon, Senator. Acting Superintendent Herman. For the St. Croix District, the parents are called in. The students go through a due process hearing at the school level. In terms of their files reviewed, a recommendation is either they're suspended because it is a level 4 infraction, but the suspension is either with or without a recommendation expulsion based upon the child's past history and the incident. In I think about one or two, I think in all of the cases, they were able to identify, don't quote me, but at least the majority of the cases, they were able to identify how the child got access to the product. One of the things that we often have issues with is that because sometimes the child or children ingest all of it and dispose of the package, and it comes in a separate packaging, it may come in a Ziploc bag, we're not able to have the police say the level of THC or what was ingested or how it was. So we go based on a description of what the children have ingested. And so that is how the schools are able to verify once the nurse checks them out and see what they're going.
Thank you for that. Was my time called? I couldn't hear.
No, Senator, not yet.
Okay, thank you. I wanted to ask, in the testimony I was reading, they spoke about substance abuse, and after the third occurrence, the student would get some kind of level of support after the third one. Why is it not after the first occurrence where you try to tackle the issue right away as opposed to waiting for a third time before you attempt to give them some type of assistance?
So, Senator, to clarify, where you're seeing 3 and 4 in there, it refers to the level of infraction. So, according to the board policy, a level 3 and a level 4 infraction is where possession or use of illegal substances fall under. We do, regardless of whatever time it is, we do issue counseling mandates and referrals for the students. So AC SOM has worked with the districts in identifying partners that we can refer individuals to. We are working on the upcoming school year, creating MOUs with partners so that we would be able to not suspend home, but try to suspend them to the partner agency for services.
Time.
Part of the policy-making process, do you guys intend on making, like, say, classes that are incorporated into the school, such as drug classes, prevention classes, conflict resolution classes, things that could teach the students and assist them with potentially even a prevention form, as well as even how to handle a situation if they're approached in school? Is that part of the planning to create classes like that they could take?
We're implementing some social emotional initiatives in the upcoming school year. We've identified time to do so. We have workshops through Heiliger. We're going to continue to partner with the Department of Health as well as BIPD in putting on workshops and informational sessions for our students. So I would say yes, not so much a class where they're getting a grade, but informational sessions where we're going to engage them in a discussion.
Okay. Well, thank you, Mr. Chair, for the time. I just want to close in saying that we spend a lot of time saying the children are our future, but if this is the future that they're seeing, we're going to have a major problem. And I think it's very important that these things are not just talked about, but they actually come to fruition and they're implemented. So I appreciate the additional time, and any other statements Mr. Stone would like to share, I'm sure he could do it on your time. Thank you, Mr. Chair.
Thank you very much, Senator Francis Heiliger. Mr. Soames, you had some additional information that you wanted to share with the good senator at this point?
Thank you, Mr. Chairman. Victor Sum III, Assistant Commissioner of Education. Having spent the last 20-something years in education, one of the things I know about Virginia's children is that they are resilient. We may be facing hard times, but our children are absolutely resilient. And I want to clarify for the senator's benefit that when I spoke about IEPs and the discussion on substance abuse. If an IEP student is suspected of substance abuse, then certainly as a part of the conversation, certainly as a part of the IEP meeting, that discussion will happen. The senator may not have sat on any, but I sat on a lot because I came from alternative education, where students who were substance abusers, that discussion was had, counseling was provided, guidance was provided, not only for the student, but for the parent as well. And so again, it was for those IEP students who identified, who were suspected as being substance users. Thank you, Senator.
Very well. Thank you. Thank you. Before we go on to do a quick wrap-up round, I wanted to ask Assistant Commissioner Craigwell Sims, now that the portal is being taken down as of June 1st, what else is happening? Are you disbanding the COVID task force? What else is happening in regards to COVID?
Thank you for that question, Senator. Dr. Crockwell Sims, Assistant Commissioner, Department of Health. I'll start and I will dovetail it over to Dr. Ellis and Dr. Hunt and the team. But the portal coming down is part of our getting into that endemic phase. We're not going to be rolling everything back in one big swoop. We are taking our time with it. We're going to be maintaining our task force and enforcement. We're also going to be maintaining our mitigation efforts because we want to be able to support individuals, even though we're giving them more of the responsibility where this pandemic is concerned and our new direction is to get into the endemic phase. We want to support that responsibility. Dr. Hunt, you can continue, and then Dr. Ellis.
Dr. Ty Hunt, Caesar, Medical Director, Department of Health. Just as Acting Commissioner Craig Wilson stated, we are moving into the endemic phase of the pandemic. And our primary goal, and my primary goal, is to continue the education to the healthcare community so that they understand exactly what the transition means. I am working on drafting the messaging that will be shared with all the government agencies, as well as the entire healthcare community, so that everybody understands exactly what being tested positive for COVID means and what it would look like. Similar to what was stated in the testimony, that we will continue to see varying concentrations of COVID within the territory, similar to the common cold and the flu. Since we do have the availability of all of the medical countermeasures, including monoclonal antibodies and both oral antivirals, we'll be using this aggressively for treatment and continuing to promote prevention with vaccination. And we will be phasing out the sort of aggressive shutdowns and panic that was really promoted or addressed with mitigation in the beginning of the pandemic. We do not have to worry about that so much now because of the resources that we have armed the territory with, including all of the medical countermeasures. So that's something that's going to be my primary goal at this point, is to continue the education to transition to what you should do if you do test positive, which does not mean lockdown, shutdowns. It will mean just the continuation of routine day-to-day activity, understanding that everyone needs to just be careful and be wise in their decisions by really maintaining respiratory etiquette and mitigating, potential additional spread. So that's what we're going to continue to be doing.
Okay. And what about the CVC? Will that continue to be up, or you'll be taking that down as well at some point in the near future?
Yes. So go ahead, Commissioner.
The CVCs right now are being supported by the remaining of the federal assistance, which is stated to end at June 30th. Our plan is to roll that operation into our clinics by way of any other vaccination that we offer. It is going to be a consistent and continuous part of our regular clinical efforts throughout the territory.
Very well. Dr. Ellis, you had anything else to add? Dr. Esther Ellis, anything else to add to the discussion regarding the...
I think this is Dr. Tyhan Caesar. From the epidemiology standpoint, on behalf of Dr. Esther Ellis, well, I think Dr. Ellis would definitely agree that what we will continue to do is make sure that testing remains available within the territory. And while we might not have pop-up testing that will go on forever, or even drive-through accessible testing at the Department of Health, we will definitely ensure that testing is available routinely in the territory, either through the ordering with medical providers, and definitely in the urgent care settings and the acute care settings of the hospitals, to make sure that we identify severe disease and make sure that we address the vulnerable populations or those who are high risk. Surveillance will continue to happen, but again, we're going to phase into the endemic phase, or transition into the endemic aspect of any pandemic. And this would mean that we're going to be monitoring for high surges and address any outbreaks in high risk settings, such as nursing homes, or just high rates in any pockets of communities. So that's what epidemiology does with any disease as it transitions and evolves over time. It's the same way that we address flu outbreaks in the community, or even dengue outbreaks. So that's what epidemiology will continue to do.
Very well. Thank you for that. At this time, Senator Viale, you had a point of information?
Yes, I did. A recommendation, somebody just texted me, and I think it was a very good idea. They said perhaps a PSA that Department of Health did that is so good, we should play it in all the schools on the PA system. And that would be a direct way for them to hear it. So play it on the PA system for those schools that have a working PA system, and then they can get that particular message. I also wanted to say that in reference to the offense and the disciplinary action, a lot of those students are really just innocent. They just tried something for the first time. A friend asked them to try a brownie. A friend encouraged them, take a taste of this. It didn't tell them it had anything in it. They trust a particular person, and then they get higher six. I wouldn't recommend for those individuals that the penalty is really severe, especially when you know it's a innocent situation. But we definitely need to just get the point across that that type of behavior is not allowed. Now, if the person makes a second mistake, that's a different story. And I just wanted to sympathize with our poor education system. Education just got to teach you everything. Everything that goes on in this community that is not taking place falls in the educational lap. You got to teach this, you got to teach that. And at some point, you really got to get the message into the homes and into the communities and into the churches that we need responsible behavior. You know, you can't be cooking a whole tray of edibles 2-3 times a week, and you're telling me that you don't know exactly what is going on. So at some point, the community need to be more responsible. And as we have this marijuana discussion, and medicinal marijuana is already the law, and legalization is definitely looming. If we can't fix our compliance, adherence, and enforcement entity, we're going to have more problems when we move to the next step. So now is an opportunity for us to really clean up a lot of these issues. If you do have legalization, it's dispensary that sell that stuff, ain't a side shop. You know, so if you begin to allow side shop to sell that stuff right now, what is going to happen when legalization come? Everybody gonna think it's a free-for-all. So we need to really take a close look as to what is going on in the path moving forward. Thank you so much, Mr. Chair.
Thank you very much, Senator Viale. Glenn Drake.
Good evening, everyone. Glenn Drake, Communications Director for the Virgin Islands Police Department. Good evening, Mr. Chair. Good evening, committee members, and good evening to community as well. I've been sitting here and listening to, to the hearing throughout the evening. And one thing that, with my input is basically I was listening to the messaging. Commissioner Ray Martinez directed me to get the messaging. That's my part. Is I played a part in getting all the creatives, the messaging, and PSAs out. Produced the spot. Had Dr. Sims collaborate with another young lady, actually my sister-in-law, who's the other voice, and my wife wrote the spot.
Oh wow!
So we have banner creation that's coming out. We have 4 banners. I spoke to your chief of staff. We're going to be sending you those 4 banners for your record. Also, we have a Spanish, a Latino, a Hispanic bilingual ad that's coming out. We have some creatives for TikTok and all the social media platform that's going to be ramping out. Last week, Friday, Commissioner Ray Martinez had an extensive meeting with the Federal Bureau of Investigation in his office in St. Thomas, where the regional director, agent in charge, his associates, his outreach program coordinators, and 2 other members from the federal arm or the federal government was in his office, and what they were actually collaborating with the same thing. They're going to be working with us. They're going to be on our next meeting, which is June 6th at 10 a.m. The next platform meeting, I already shared this with the team as well. And they're going to be working with us and utilizing the resources. They're going to be coming to our schools. They're going to be working and bringing all the resources to the Virgin Islands Department and the task force itself. That wasn't mentioned today. Also, who's joined the task force is the health analyst for the CDC, Ms. Warshi as well, the former police commissioner who's working with us closely right now, Mr. Rodney Karad. He's the intelligence officer for the Heiliger Department. So we have a lot of resources that Commissioner Martinez has been working diligently and working hard to get all these resources together, because what's amping up right now, as you mentioned, is the fentanyl. It's in Puerto Rico, and they're having that situation right now in Puerto Rico, and they're going to bring their resources. We're going to duplicate some of the stuff that they're doing there. So you guys are going to be seeing a lot of things happening in weeks to come, and you guys are welcome to sitting on the next meeting, which is June 6th at 10 o'clock. I can have the Virgin Islands Police Department, Ms. Hanson, send you guys the link, and you guys will be more than happy, more than free to join in part of the conversation, because it's our community as well, and at the end of the day, it's our children. So I just wanted to add that. So to reiterate that again, you're going to see some strong messaging, like Senator VLA mentioned, in the schools. You're going to be seeing more strong messaging coming out, but we needed to get something out right away. And that's why you're hearing what you're hearing now. It was, I heard Senator Carrion mention a crisis. And if you look at the word, yes, it is a crisis. Because if you look at the definition of the word crisis, it's amping up, it's danger, and it's even like one member in the task force said, 1 is enough. So yes, it is a crisis. And we're going to handle the crisis collectively as a government, as a whole, as a Senate, and get this thing under control. So thank you for having me.
Good job. Very well. So I think is there any other burning questions from my colleagues? Don't all rush at it.
I don't want what I said to be confused. What I'm trying to say, if we're having a crisis, then we need to provide the data for it. So, you know, we could speak and we could talk about it, but we need data to back up what we're saying. And I think it's important for us to have that information. So that's a point I'm trying to bring across. We see it, I see it. I have children in high school, so they tell me the stories. You know, so we know that we have a situation, but we just need to do better in our enforcement, and we need to do better in our messaging, and we need to do better in our data collecting, so that when we say something, we have data to back it up. Thank you, Mr. Chair.
Thank you very much, Senator Carrion. Senator Blyden.
Thank you, Mr. Chair. And based on my last colleague just stated in terms of data, my question to, I guess, the police department, in terms of toxicology reports, actual toxicology report being done on youngsters once admitted to the hospital to exactly find out exactly what type of drugs they took, so we can have the accurate data moving forward to know how to deal with the situation. Is that being done? Can anyone answer that question?
Lieutenant, are you aware?
You have to pay in mind, these are minors. Please, they are minors. And unless they're a suspect or they're arrested, there's certain things we cannot do. Did you get it? Did you hear me?
Yes, I can hear you. I hear you loud and clear.
I'm sorry.
That's fine. That's fine. I understand what you're saying. I know in the testimony from Dr. Sims on behalf of the commission, they mentioned 18-year-old also. So I was just asking in general, have that ever been done in terms of getting that data from those individuals?
What I can give you is that VIPD is more looking towards the people who is giving the edibles to the kids as an effort to fix the problem.
Thank you so much for your response. Thank you, Mr. Chair.
Very well. Thank you.
Thank you.
Senator Vieira, you had anything else? Good. Very well. Thank you. I think this was a very good discussion. It's getting late into the evening. The guys in media have been here all day, and we're going to wrap up quickly. Alma, you had Senator Francis Heiliger. You got anything?
I just wanted to say that I do appreciate this hearing so we could be educated and learn a little bit more. And as legislators, we know what our part is to do. And, as Mr. Som say, our children are resilient. And I don't have a problem with them being resilient and dealing with difficult conditions and quickly recovering after a hurricane. But to get an education, that should never be a part of the discussion. Thank you so much, Mr. Chair.
Thank you very much. I'll just quickly go around the table to the testifiers. Any closing comments? We could start out with you, Dr. Craigwell Sims.
Thank you, Senator. I would like to say thank you on behalf of our team at the Department of Health for allowing us to be here today to speak to this concern, this issue. Thank you to the task force, members of the task force for your collaborative work thus far. I also want to quickly mention that this is the tip of the iceberg. When we're talking about use of any type of substance, we're also talking about anything that happens with behavioral and mental health as well. And so it's a long road. It's going to be a long road. One of the things that I think we are trying to push forward is the honesty in all of us. A lot of us are parents, aunts, uncles, etc. And having those open and honest discussions about your own experiences will help us in the efforts that we're making now. This isn't new. When we were in high school, we had it all, just on a different name. So we need to be able to tap back into those experiences, communicate with our children, and move forward. So I'm looking forward to that collaborative effort. And just thank you once again, and thank you to the Department of Health team.
Thank you very much, Dr. Craigwell Sims. Quickly, Department of Education, Assistant Commissioner Soames.
Thank you, Mr. Chairman and other members, other senators, for the opportunity to address this issue. We live in a community where alcohol use, substance use, particularly marijuana, is accepted. I've seen students at 7, 8, 9, 10 where daddy is telling his daughter or his son, here, take a swig of this, drink some cerveza. I hear parents, marijuana is a healing herb. And at the Department of Education, all of these societal issues now come to education. And we are, in a sense, sidetracked because our primary mission is to provide education, as Senator Violet says, but we have to address the whole child. And if that involves illegal substance use, then we will address that as well. We are vigilant in our sincerity in our attempt to combat this. We truly appreciate our partnership with the Department of Health, with the Department of Police, with DCLA, and certainly with the Department of Human Services. This is not something that's going to be resolved in short order because of the attitudes we see in our community. But nevertheless, we will address this. We will put our best foot forward every time to resolving this issue, not for ourselves, but for our children. Thank you very much, Mr. Chairman.
Thank you very much. Mr. Soames, Virgin Islands Police Department, Deputy Chief, any closing comments?
Yes, sir. Chairman Novelli Francis Jr., we'd like to thank you for the opportunity. On behalf of Commissioner Ray Martinez, Sean Santos Sr., we thank you for this opportunity to come and try to educate and ask for some assistance from yourself along with your colleagues. I really am thankful for working with the task force. I just want us to continue as we try to safeguard our youngsters and educate our parents as to what the children are facing. So I want to thank you for the opportunity, and I just want you to just assist us as best you can.
Very well, thank you. I want to thank all of you for coming before this Committee of Health, Hospital, and Human Services today. providing your testimony and responding to the questions. Again, it's not just for us, but for the community to be aware of what's going on. You know, this community expects certain results, but at the same time, when we start to make changes and start to enforce, you know, they become very critical and cynical about what we're doing. But I tell you, it can't be business as usual. We have to take the bull by the horn and do what needs to be done, again, to save this community. So thank you for all that you do. On the behalf of the committee, I also want to thank Commissioner Encarnacion and all the members of the COVID task force and all the work that they have done and put forth for this last 2 years to keep us safe. Yes, we're in the endemic phase of this, but certainly we have gotten a strong foundation built up from them, you know, starting from the governor and the task force. And now we're at the level where we should be able to be self-sufficient based on the experience and exposures that we have incurred. I, again, thank my staff for organizing today's hearing. Thank you for coming, my colleagues as well, media, security, all that was involved in making this session successful, to include our protocol officer and everyone else. The Committee of Health, Hospital, and Human Services is hereby adjourned. God bless.